eager to have this purely academic program from none other than but Dr. Professor Prakash Kothari. His detailed biodata I'll be reading after a while, but this is just an initial announcement. Please hold on for a while. We will be starting our session in just 5 to 7 minutes. Thank you. Vivek, Vivek, start. Good afternoon, everyone, and a very warm and humid welcome to you all. Because it's Goa, I will add the word humid as well, because all of you are feeling that warmth and that humidity of Goa. So, welcome to all to Goa and the National Conclave of Sexology, which is organized by Council of Sex Education and Parenthood International, CSEPI. And today's event, the pre-conclave workshop, is also a part of it. Management of male sexual dysfunctions. This would be the topic which we all are eager to learn from none other than Dr. Prakash Kothari. His entire biodata will be much longer than any other talk, but he actually does not need any introduction. Everyone knows a pioneer sexologist of India having a career of more than 5 decades into field of exclusive sexual medicine. In fact, as I said, pioneer, he has carved a very nice path for all of us, all younger generation who have dared to take the faculty of sexual medicine, is all thanks to the nice path created by Dr. Prakash Kothari, sir. He is a Padma Shri award recipient, one of the third highest civilian award. He was the founder, head of the Department of Sexual Medicine at KEM Hospital and GS Medical College, Mumbai, the first department of its kind in the country. He has been practicing since early 17s and has counseled over 45,000 patients on record. He has presided over the 7th World Congress of Sexology and 1st International Congress on Orgasm. His original work on Kama Sutra and Orgasm put India on the world map, I would say the modern world map. India was already existing in the ancient world map. The Asian Federation for Sexology honored him as Sexologist of Asia. The World Association for Sexology has bestowed upon him the title Man of the Year and conferred the highest award for the WAS World Association of Sexologists Gold Medal. He is also a recipient of CSEPI Gold Medal. He was awarded Padma Shri, I already announced it, by the President of India, the one of the top civilian award of the country for his significant contribution in sexual medicine. So today's workshop is entirely based on the utilitarian approach, not just what to do it. Everyone, probably all of us know in sexual medicine what to do it, but very few know the very nice nick of how to go about it. And this is what the USP of Dr. Prakash Kothari sir is. So I won't take much time. I request Professor Dr. Prakash Kothari to start his workshop. Thank you, sir.
Hello. You're all right? Friends, it is indeed a pleasure for me to be among you this afternoon. And I thank you, Dr. Malde, for your remarks about me, general introduction, and you, ladies and gentlemen, for endorsing them. Well, I intend to focus my professional attention on management of sexual disorders. First, we will talk about diagnosis of sexual disorder, then the treatment of sexual disorder, then a new step which I found extremely useful in my practice. So that is a utilitarian approach where patient gets a lot of confidence. It is in, I mean, it includes education, it includes counseling, it includes therapy, it includes research. And I strongly feel that 9 out of 10 patients, what I am seeing, you'll be able to handle after this few hours workshop. Because I'm sure you will not commit that mistake which I have committed. I have been practicing in this field of sexual medicine since about more than 5 decades, to be exact, 52 years, and have been shocked by abysmal amount of sex ignorance, sex negativism, sex myths and fallacies, not only among the uneducated people, but also among the highly educated ones, including myself. I remember, say about 52 years ago when I started practice, I used to ask questions. How is sex? How is your sexual life? Today, I feel that such questions are akin to how is your urinary life? How is your defecation life? Now, then I thought that let me learn a bit more. I've been to Masters and Johnson in 1973. Once again, in doing my undergraduate workshops. Then I did my postgraduate workshop in 1975. I tried to practice those models, but they were too long and too non-structured. Then I started Hartman and Fithian's model, who happened to be my good friends also. That also was not working out very well in our Indian setup. Then I'd been to Cornell University to meet Helen Singer Kaplan, very well-known psychiatrist. Somehow or the other, I thought that tried the model for a few months, but didn't work properly. At that time, I was just doing my MBBS, nothing more than that. I thought that I need to have, when I started practice, I thought that it's much more than that. It's not easy because this is not only psychiatry. This is not only urology. This is not only gynecology. This is not only endocrinology. It's combination of all the branches. Why? Because brain and nerves stimulate. Heart and blood vessels circulate. Hormones regulate. Local tissues, muscles, and bones facilitate. So it's amalgamation of almost all branches of medicine. But one can easily handle it. It's not difficult at all. At the same time, before I start, I must tell you, you can stop me anytime. Anytime. If you have not, things are not clear with you, just stop me. I'll repeat that. Even if you ask me 10 times, fine, there is no problem at all. And I'm not come here to teach you or something like that. No, we learn from each other. No? So this is a very simple thing. We are going to exchange our views. Well, then I started to develop a new model. Because in KEM hospital, there used to be sometimes 150 patients in an OPD or 200 patients in an OPD. So I was, it's difficult to handle. We developed a new model. The model was very simple. We used to ask 4 questions to the male. This is all what I am telling you is original, indigenous. Excuse me. Ask that gentleman to either you come in or get out, please. Can we? वो दरवाजा बंद कर दो जरा. Yeah. We asked 4 questions to the male and 4 to the female. Desire, erection, penetration, and orgasm. This is for the male. Similarly, desire, lubrication, penetration, and orgasm. 99.9% of the problems revolve around these 4 parameters. This is all original. You will not find in any internet or anything like that. Maybe in the years to come, yes, someone might take up my research and tell that this is I have done. But remember one thing, this you will not find it anywhere else. Now, these are all 4, and you can diagnose the case as if you are diagnosing a respiratory problem or a gastrointestinal problem. How many are family physicians here? How will you treat a कोई diarrhea का case आया? What do we ask? जुलाब पतले हुए कि जाड़े हुए? Do everybody understand Hindi? All? Yeah. जुलाब पतले हुए कि कठिन हुए? आपको मालूम पड़ता है अमीबिक है कि बैसिलरी डिसेंट्री है. पेट में मरोड़ आती है कि नहीं? आपको मालूम है कि आपको बेलाडोना ऐड करना है कि नहीं करना है. साथ में कुछ कॉन्स्टिपेशन फूड लाइक दही भात, साबूदाने की खिचड़ी, केला, चिकू, सफरजन, you can give, that's a constipating binding agent. Similarly, you can diagnose this also. Most of the cases can be very easily and quickly and very simply you can diagnose this. Now, what is desire? Desire क्या है? Urge. What do you think? What is desire? What is desire? Sorry? That is one, right. Your good name? Dr. Azam. Frequency of sexual thoughts. That's how you can assess an individual's desire. Which other way you can? Sorry? No, libido is a vague thing. Precise. Libido, desire, these all are same. Yes, attempts, sexual attempts. That's right. Anything else? Sorry? Frequency of masturbation, wet dreams, even sexual attempts. So how best you can frequency of sexual thoughts? Dr. Azam, what you said was absolutely correct. Second would be coital experiences. Third would be other sexual activities, masturbations, oral sex, anything. Sometimes patients will come and tell, Doctor, मेरे को desire नहीं है. Ask him, when did you? Don't ask him, do you masturbate? Never ask. I remember there was a survey from one very famous company of famous newspaper company, the most popular in the country. They asked me a question, Dr. Kothari, we did a survey when 9 out of 10 people, 90% of the Indians that don't masturbate. I said, what question did you ask? He said, we asked the question, do you masturbate? Only 10% of the people said yes. I said, now you frame the question in a different way. When did you masturbate last? And 90% said, kal, ek hafta pehle, ek din pehle, 2 din pehle. And they came to a conclusion that 90% of the people were masturbating. What is masturbation? define what is masturbation. Agreed, self-stimulation. By chance, if I were to define, I would define it in this way, that it is an intentional self-stimulation done by oneself to oneself, and which may or may not be pursued to the point of orgasm, or which is usually pursued to the point of orgasm. Mind you, now patients are very smart. By chance, आपने कुछ ज़्यादा बोल दिया, वो पकड़ के रखेगा. So that usually word is very important. Everyone may not reach climax. They will just fondle the penis and be happy. Just डिजायर में क्या हो सकता है, क्या प्रॉब्लम हो सकता है? एक तो ज्यादा हो सकता है, नहीं तो कम हो सकता है. मैं ये hypo active and this active, I consider this as a bullshit, and I am telling you on the basis of I have seen so far about 55,000 cases. तो कोई भी आदमी होगा तो उसको आ जाएगा. एक कोई आदमी ने 55,000 दाढ़ी की होगी, आधी रात को उठाओगे तो अस्त्रा सीधा ही घूमेगा, उसमें कोई इधर उधर होने का चांस नहीं है. तो इट्स अ वेरी सिंपल थिंग. Either desire is high or desire is low. What are the conditions where you will find high desire? Desire ज्यादा कब होता है? Mania. You're a psychiatrist? No? Your name? Dr. Sayed. Dr. Sayed. Very nice. Nah, mania, yes? Tell me, what happens in mania? Any psychiatrist here? Yes, lovely. Your name? Your name? Dr. Roshita Khare. हाँ. Euphoric. ठीक है. Hypersexual. Bettina, please. Grandiosity. And? Lack of insight. Everything is more. हर चीज ज्यादा है. Over talking, over this thing, everything is over. Sex के ख्याल भी ज्यादा आ जाते हैं. Am I clear? So in that sense, so this is mania. Hypomania, वो उससे थोड़ा कम होता है. Sometimes in schizophrenia, there could be very high desire. There are fixed false beliefs in 295 or schizophrenia. Hallucinations, there could be delusions, there could be lack of insight. Am I right? So you have to, when you take the history, these things are important, but only when अगर desire की कोई complaint करता है तो. So these are the psychological causes. What about the organic causes? Desire कब ज्यादा होता है? Sorry? Brain tumors. Fantastic. ताली बजाओ भाई. क्या नाम है आपका? प्रदीप कुमार बुटले. कहाँ से आ रहे हो? नागपुर से. I don't know oranges have such great power. Very nice. Brain tumor. Yes. Any other condition? Post epilepsy. That's right. Any other? Right. Any other? No, never. Prostatitis, no. वो ऐसा बोलते हैं लेकिन है ही नहीं ऐसा. विश ऐसा होता तो बता देता है. Post alcohol, post drugs, charas, ganja, not ganja, charas, cocaine. Am I right? Marijuana, yes, yes. How does it taste, marijuana? Not taste. Smart. Tell me about decrease in testosterone. Desire कभी कम होता है. Sir, psychological पहले बोलेंगे. हाँ? Depression. What are the? You see, basically remember, mania is also a mood disorder, which is opposite of depression. इतना ख्याल रखना भाई, सेक्स का सब्जेक्ट है, अंधेरा रहने दो अभी तो है, और कोई प्रैक्टिकल्स होने वाला नहीं है, फिक्र मत करना. Where were we? Depression. What are the other symptoms of depression? There will be a triad of symptoms: hopelessness, helplessness, worthlessness. रात को नींद देरी से आएगी, सुबह आंख जल्दी खुल जाएगी, भूख नहीं लगेगा, मन उदास रहेगा, कभी कभी खुदकुशी के ख्याल भी आ जाएंगे. These are depression. उसमें ज्यादातर डिजायर कम रहता है. वेलकम मैम. ज्यादातर डिजायर कम रहता है. ऑर्गेनिक कंडीशंस डिजायर कब कम होता है? डायबिटीज नेवर. डिजायर इज 4+. हाँ, डिजायर बहुत अच्छा रहता है डॉक्टर साहब. डिक्लाइनिंग इरेक्टाइल एबिलिटी रहेगी. हाँ, वो वैसे नहीं यार, डिजायर थोड़ा कम होता है. हाँ, वो तो थियोरेटिकल है. लो टेस्टोस्टेरोन, डिजायर कम का कभी होता है. ऑर्गेनिक, यू आर राइट, यू आर राइट. हाँ, लैक ऑफ अट्रैक्शन, बहुत बड़ी बात बोल दी आपने. लेकिन ज्यादातर ऑर्गेनिक कंडीशन में डिजायर कब कम होता है? एक तो ड्रग्स, एंटी हाइपरटेंसिव्स, एंटी साइकोटिक्स, एंटी एंड्रोजन्स, एंटी एपिलेप्टिक्स, Ayurvedic medicines which contains Rauwolfia serpentina and ganja can block the desire, can decline the desire. Rauwolfia serpentina continuous use can lead to decline in sexual desire because of depression. There are many herbal medications which are available in the country which has got Rauwolfia serpentina. Otherwise, we all know that testes manufacture testosterone, gets metabolized in the liver, and then acts on the target organ. So any garbad in testes or liver can decline in sexual desire. I love photographs. Do you know why? Because photography and sex both develop in dark. And in both you need to click. Only zooming is optional. Am I clear? What are the sudden desire कम क्यों होएगा? हाँ, desire ज्यादा कभी होगा suddenly.
Regarding low desire, I have one.
हाँ, yes please.
Every time the patient, depression patient or OCD patient, they are on antidepressants. So low desire because of depression or because of antidepressant. It's difficult to.
Both can lead to this. मैं क्या पूछता हूँ, suddenly desire कैसे बढ़ जाएगा? Brain tumors आपने बताया हो. Any other condition can you think of? Psychological conditions? Provocation. Long abstinence रहा और अचानक मौका मिल गया तो ऐसा हो सकता है. सडन डिजायर कम कैसे हो जाता है? पोस्ट, यार वो तो तुम वेग बोलते हो. पोस्ट ट्रॉमेटिक ट्रोमा कौन सा लेके? योर नेम? योर नेम? सुजीत. हाँ, कोई पुरानी चीज याद आती है आपको? दिल टूट गया. दिल टूट गया तो नॉट ओनली दिल टूट गया. इफ यू कम टू नो that your partner is having sexual affair somewhere, desire would go down immediately. One thing I have noticed in my practice, that if there is loss of attraction, वैसे केसेस को ट्रीटमेंट करने में मुश्किलात आती है. The results are not that encouraging. This is, I'm telling my view. There are stalwarts sitting here who could be, who may have different experience. Please share. Then comes what investigations? Another very common condition, but always overlooked, is anemia. Always get hemogram done, you know. Hemoglobin agar kam raha, to ye dikkat ho sakti hai. This I learned at KEM hospital. Liver function tests we need to advise. Hormones, prolactin and testosterone. High prolactin, common cause. What could be the cause of high prolactin? Most commonly. Agreed. Right. Anything else? Sorry? Pituitary tumor. Yes, sir. Right. Pituitary macroadenoma. Anything else? Antipsychotics. Most common. You see, all the traditional antipsychotics, if I'm not wrong, if I'm wrong, please correct me. Excepting aripiprazole और क्यूटियापिन, एक दो को छोड़ दो, बाकी जो पुरानी हैं सब प्रोलेक्टिन जरा चेक करना बेटर रहेगा. सॉरी, दैट इज बुलशिट. कल्चर क्या है का सोशल बैकग्राउंड? बात करो यार, कोई ठोस बात करो. कल्चर तो पूरा आ जाता है नहीं यार. We must have a definite thing, you know. We want to impart and exchange skills. को सचमुच क्या होता है? Testosterone. Decline in testosterone. It could occur because of the age. You see, as a man ages, there is a decline in testosterone. I have found results of testosterone good if at all testosterone values are low and LH values are high. Then that gives you a good result. We will discuss about what we should use when we are giving testosterone, which are the best salts. That will do it in the next one. Psychological evaluation. Sometimes if the psychiatrist is very busy, by chance not devoted enough time, then sometimes this 295 and they might creep in without knowledge. So if at all, if you want to take somebody for the long-term treatment, it would be advisable to get a psychological testing done so that personality evaluation can throw some light. But however, it would be best to get it evaluated by a competent psychiatrist. Then comes erection. Now, after desire, what next? After desire, you get erection. Excitement. Your good name, sir? Dr. Ramesh Maheshwar. Dr. Ramesh Maheshwar is from Pune. He runs an institute over there. How many people think that the desire can lead to erection? Desire leads to erection. Yeah. Does desire leads to erection? Petkar Sahib. Yes, naturally. This is what we believe, am I right? But I say no. Desire does not lead to erection. Why? Suppose if I am here, my wife is there, I have desire, but I am not getting erection. Because sexual grounding is not taking place in me. What I mean by sexual grounding is I'm not perceiving the stimuli input as sexual. The moment all of you go away and I and my wife are left alone, I'll start getting erection because sexual grounding has started. So this confirms that arousal is the manifestation of sexual grounding and not desire. Am I clear? This is a new theory, my own theory, but it is valid because very simple. Desire cannot lead to erection immediately. Desire in action needs to come. That only can come if you perceive the stimuli input as sexual. Am I right, ma'am, what I'm telling you? No? This is, I call it a sexual grounding, wherein individuals perceives the stimuli input as sexual. You can explain the entire sexology or sexual dysfunctions on the basis of this particular thing. Anyway, for the moment, we are not going to elaborate on sexual grounding. We'll tell Dr. Malde to have another workshop only on sexual grounding, and where we can discuss that. Let's say it leads to erection. Then what? Very simple. If a man gets erection in one set of circumstances, and if not in the other, if he gets in the early morning, if he gets with one partner, if he gets with fantasy, if he gets during masturbation, but not at the time of coitus, then the problem is situational and not constitutional. I would explain to my client in this way that, look, if I've got a head like this, if I chop it off from here, if it falls on the ground, even if I raise my arm 10 times, my forearm will not be raised even once. And if it is raised once, will you believe that my hand was detached? No. So if you get erection in one set of circumstances and not in the other, organic factors by and large are ruled out. Organic factors, I'm sorry. So organic factors by and large are ruled out. Now, how will you assess how a man gets erection? Either by the sight, odor, taste, touch. There is a sex center in the brain. When it is aroused, the messages are relayed down to the sex center of the spine. When the messages are enough, the further messages go down. During this process, there is flow of blood and a man gets erection. Now, to understand a little bit of mechanics of erection, when you are aroused, there is a release of nitric oxide. As a result, there is flow of blood in the corpora cavernosa, the two upper cylinders of the penis. And the flow increases. So that compresses with the outer covering, which is known as tunica albuginea. There are veins. So the vein gets compressed. So the blood is prevented from escaping and an individual gets hard on. He gets an erection. Now that erection, after a little further arousal, so he gets stiff erection, but after a little further arousal, still there is contraction of the muscle known as ischiocavernosus. And this muscles contract, the veins are compressed further, and a man will get stiffer erection. The erection would become more harder. So this is the process of erection. Just to let you know what things takes place so that the concept becomes clear. But by and large, If you get a stiff erection for a while, organic elements are ruled out. You can do all the drama, whatever you want to do, examination, this, that, but in your mind, you should be very clear that this is the thing. The problem is situational and not constitutional. How will you assess erection? Rigidity of erection, angle of erection, and sustenance of erection. The man has desire, gets erection, and he loses it. आप लोग आगे आ जाओ तो अच्छा रहेगा. Can you please come in front? Come in front, please. आगे आगे आ जाओ. Please come in front. आदाब आगे आइए. Now let's talk about rigidity. There are three varieties of situations which I have come across in my clinical practice. Number one, it is non-penetrable rigidity. Number two, it could be doubtful penetrable rigidity. Doc, I have desire, I get erection, but it's stiff, but not that stiff. And the last one is, I have desire, I do get erection, but I lose it prior to penetration. इससे चौथी चीज कोई मेरे पास आई नहीं है. अगर आपके पास कोई आई हो तो मुझे बता सकते हैं. Now, let's handle one after the other. Non-penetrable rigidity किस वजह से हो सकती है? Drugs, that is reversible. एक दवाई लिया आपने और समझो बराबर उसी दिन से ये प्रॉब्लम शुरू हुआ. You withdraw that drug and the medication can be changed to a drug which will have the same effect on the medical target symptom without paralyzing the sexual system. And that is possible. Injury or surgery, कुछ नहीं कर सकते हैं. Atherosclerosis, अगर severe हो गया, even PDE5 may not work. Severe atherosclerosis. Doubtful penetrability. Doctor साहब stiff है, लेकिन not that stiff. This is a catch. Most common condition, sir, is diabetes. I have a lot of desire, but there is decline in erectile ability at all times. That would be the situation in this. Now, these cases can be managed very well without any difficulty, but they need to be drug induced. कभी हार्मोन की कमी होती है, कभी ब्लड सप्लाई की कमी होती है, कभी कोई न्यूरोलॉजिकल प्रॉब्लम होता है, कोई माइनर ड्रग्स की साइड इफेक्ट हो सकती है, बट ऑल दिस कैन बी मैनेज्ड वेरी वेल. What happens? Brain, you see, this is not only one branch. Brain and nerves, as I mentioned to you, either by the sight, odor, taste, touch, there is a sex center in the brain. When it is aroused, the messages are relayed down. When the messages are sufficient, the further messages go down. There is a flow of blood, and our youngest delegate and it goes down. Now, brain and nerves stimulate. Welcome, Dr. Prasad. Brain and nerves stimulate. Heart and blood vessels circulates. Hormones regulate. Local tissues, muscles, and bones facilitate. Means anything can disturb the erectile mechanism, but this can be solved also very, very effectively. पर आपको मालूम होना चाहिए कि इससे डिस्टर्ब होता है, तो ही आप उसका इलाज कर सकोगे. अंधेरे में तीर लगाने से लगे नहीं लगे, ज्यादातर नहीं लगेगा. How will you rule out the nerves problem? कोई दवा की वजह से हुआ. Autonomic nervous system involvement. Very simple. Ask the patient to lie down. Take the blood pressure. Ask him to stand up immediately. Within a minute, take the blood pressure in standing position. If there is a fall of more than 30, that is postural hypotension, probably autonomic nervous system are the cause. कोई बड़ी बात नहीं है, लेकिन मालूम होगा तो करोगे. ये भी मैं 10 साल के बाद सीखा हूँ. I must tell you that. Abroad में भी कोई इस तरह से एग्जामिनेशन नहीं करता है. दूसरा, डॉक्टर, your name? Dr. Vinod Vijayan. He would know it better. On your deep inspiration, there are changes in the heart rate. In autonomic nervous system disturbance, you won't find that. So you can conclude and stamp your diagnosis. Also, Valsalva maneuver में दिक्कत हो जाएगी. अगर ऐसा doubtful लगे, you can get it verified by a cardiologist. Sir, please correct me if I'm wrong. Ma'am, psychiatrist also here. Second is local sensations. Penis ka local sensation is S2, 3. Sacral 2 and 3. ठीक है. Penile sensation. Take a BC reflex. BC reflex is, suppose this is the penis. यहाँ पर आपने जरा प्रेस किया तो you will get the jerk between the scrotum and the anal region. Positive रहा तो ठीक है, negative रहा तो you can suspect that some neurological deficit could be there. Anal sensation, perianal sensation, once again S2, 3, 4. I do it cremasteric reflex because it's very simple, but it's basically S4. So this is how you evaluate the neurological problem of the erectile dysfunction. Very simple. Am I clear? Yes or no? क्या यार आप लोग बोलते नहीं हो. तारिक साहब चाहते हैं कि मैं कोई शेर सुनाऊं यहाँ पर. आपको पसंद आता है? गजल वजल पसंद आती है? हाँ कि ना? आवाज नहीं आया बराबर. आप मुझे कभी भी बोल सकते हो. क्या बात है. कांटों से भी प्यार किया है कभी कभी. कांटों से भी प्यार किया है कभी कभी. फूलों को भी शर्मसार किया है कभी कभी. कांटों से भी प्यार किया है कभी कभी. फूलों को भी शर्मसार किया है कभी कभी. अल्लाह रे बेखुदी तेरे पास बैठकर तेरा ही इंतजार किया है कभी कभी. अभी आप सब लोगों के लिए मुझे एक अगर 2 लाइन कहनी है तो कह सकता हूं. यहाँ पर अहमद फराज का एक शेर है, उम्मीद है आपको पसंद आएगा. कि खरीद सकते तो जिंदगी देकर खरीद लेते फराज. खरीद सकते तो जिंदगी देकर खरीद लेते फराज. लेकिन कुछ लोग कीमत से नहीं किस्मत से मिला करते हैं. So this is about the cremasteric reflex, the neurological evaluation. Then comes the vascular. Check the femoral pulsations. वो separation होने के पहले अगर वो बंद रहेगा तो फिर आगे देखने का कोई सवाल ही पैदा नहीं होता है. And take the blood pressure of the penis. There are 2 superficial blood vessels and 2 deep blood vessels. Take the blood pressure of the penis. Now, blood pressure of the penis divided by blood pressure of hand gives you a pinobrachial index. Very simple. दिखता बड़ा है, बाकी कुछ है नहीं. 0.75 से ऊपर रहा, there is no vascular problem. 0.6 से नीचे रहा, don't try. Surgery is the only answer. Only thing between 0.75 and 0.65 रहा, that is penobrachial index, then ideal cases would be for PDE5. PDE5 की बात हम जब भी ट्रीटमेंट की बात करेंगे तब करेंगे. Am I clear? Sorry. Repeat again. माने एक आदमी है जो यहाँ पर ब्लड प्रेशर अपन फीमोरल पल्सेशन चेक किया, मीन्स थोड़ा बहुत अंदर जाता है. उसके बाद देर आर 2 सुपरफिशियल ब्लड वेसल्स एंड 2 डीप ब्लड वेसल्स इन द पीनिस. डॉपलर से आप चेक कर सकते हो. पीनाइल ब्लड प्रेशर एक कफ आता है छोटा सा, उससे आप ब्लड प्रेशर ले लो. तो ब्लड प्रेशर ऑफ द पीनिस divided by blood pressure of hand gives you a penobrachial index more than 0.75 normal. उसमें वास्कुलर इनसफिशिएंसी नहीं है. आप शौकिया उसको देना है दवाइयां तो दो, लेकिन कोई जरूरत नहीं है, उसके बगैर भी ठीक हो सकता है. कॉन्फिडेंस बिल्डअप करने के लिए दे सकते हो. दूसरा 0.6 से नीचे रहा, इलाज का कोई फायदा नहीं है. सर्जरी ही एकमात्र इलाज है, पीनाइल इम्प्लांट. अदरवाइज राम नाम सत करो तो भूल जाओ, बाकी कुछ नहीं. इसमें कुछ हो नहीं सकता है. पैसे बर्बाद मत करो, टाइम भी बर्बाद मत करो. कई बार ऐसा हो सकता है कि अगर हार्मोन लेवल थोड़ा लो हो तो PDE5 may not work. So you push up the hormone level and the PDE5 will start working. PDE5 माने ये जो सिल्डेनाफिल, टेडेलाफिल, वर्डेनाफिल, वो जो दवाइयाँ आती है उसकी हम बात डिटेल्स में नेक्स्ट सेशन में करेंगे. आप जब ये एग्जामिन करते हो, ऊपर से नीचे जा रहे हो, आप जरूर लीवर देख लीजिएगा. लीवर देखना कोई दिक्कत की बात नहीं है. साथ में देखिएगा कि उसको गायनेकोमेस्टिया तो नहीं है, उसका हेयर डिस्ट्रीब्यूशन कुछ कम तो नहीं हो गया. दैट विल गिव यू अ हेपेटिक idea of some hepatic pathology. Am I clear, sir? कभी कभी बोर हो जाओ तो मुझे बता देना. I can give you a ghazal of your choice, शायरी of your choice. हाँ, सॉरी, आप मुझे फरमाइश कीजिएगा, मैं बता दूंगा. After every slide, 5 slides. वो अपना I hope that our Malde is not here. तो बोलेगा. Now muscular pain, मायोपैथी अगर रहा फैमिली में तो कुछ प्रॉब्लम्स हो सकते हैं. फैमिलीज में चलती है मायोपैथी, स्पेशली ग्लूटियाई मसल्स की मायोपैथी. मैंने आई हैव हैंडल. जब भी वो जर्क लगते हैं तभी ग्लूटियाई मसल्स के रहते हैं. एंड वीकनेस, जॉइंट पेन्स रहा तो, रोमेटॉइड आर्थराइटिस रहा, तो सुबह होता है तो शाम की दे दो, करने को बोलो. शाम को होता है ऑस्टियोआर्थराइटिस तो सुबह करने को बोलो. बड़ा सिंपल कॉमन सेंस है. इंटरकोर्स के पहले आपको चाहिए तो कुछ दवाई दे दो, आप पेन किलर दे दो, गर्म पानी का बाथ लेने को बोलो, तो थिंग्स बिकम कंफर्टेबल. बट नीड टू फाइंड आउट व्हाट इज द कॉज. इरेक्टाइल टिश्यू डिसफंक्शन क्या हो सकता है? क्या हो सकता है? ट्रेमेंडस कर्वेचर रहा तो क्या होगा? पायरोनीज. By birth, congenital configuration of the corpora cavernosa, abnormality of the investing or bucks fascia, and the most common, what you said, your name, doctor? Sorry? No, Mr. Digge. And very rightly he said Peyronie's disease. Normally you get this Peyronie's around the age of 35, 40. You get a plaque, usually at the level of tunica albuginea, sometimes even corpora cavernosa. और corpora cavernosa को अगर ज्यादा प्रेस किया तो blood supply hamper होगा corpora cavernosa, and as a result a man may not get proper erection. Along with that, the presenting symptom will be curvature of the penis, extreme curvature. But curvature बहुत रहा तो ठीक है, unless it is painful, Don't fiddle around. Then difficulty in sustaining the rigidity. क्या हो सकता है? A man has desire, gets erection. डॉक्टर साहब मुझे इच्छा होती, इंद्रिय में ताकत भी आती है, लेकिन करने को जाता हूं, उसके पहले बैठ जाता है. Simple knock on the door. So any distraction can lead to decline in sexual desire. Another thing which is most common, people blame venous leak. लेकिन बहुत कम केसेस आए होंगे. हमारे केईएम में इतने एक्सपीरियंस में एक केस आया था. Venous leak में टिपिकल हिस्ट्री होता है. I have desire, but he gets erection for a second. हुआ नहीं हुआ तो he will lose the erection. But another common condition is phimosis. He has desire, gets erection. If he masturbates, there is no problem. But when he tries to penetrate, there is a resistance of the vagina. Skin rollback hota hai. He gets a pain. And if pain occurs, he will lose the erection. एक बार lose हो गया तो दूसरी बार, when he tries, he will anticipate pain and he will lose the erection. So remember, problem could be organic, but there is always a psychological overlay. What happens is there is anxiety over a sexual situation, which is usually brought about by the negative feelings, which gets into conflict with the experience of failure. The failure recurs, anxiety increases, and a vicious cycle gets set up in which hostility, shame, guilt, fear becomes the part of the pattern for any potency problem. तो ये मैं अंग्रेजी में बोला इसके लिए कि आपको ऐसा नहीं लगे कि मुझे अंग्रेजी आता नहीं है. माने मुझे अंग्रेजी भी आता है. तारीख में आपको ऐसा लगे कि शायद मैं हिंदी में ही बात कर रहा हूँ. And once failure, the next time, even if he's better prepared, he will not have confidence. He will not have. He becomes a spectator of his own game. But you can break it. And once he becomes a spectator, it's a problem. Because anxiety हो गई तो sensuous situation मुश्किल होगा. You can't be anxious and sensuous at the same time, can you? Difficult. माने एक ही अवस्था में चिंतित और उत्तेजित नामुमकिन है. Am I right, sir? I cannot ask you what is your experience because you have got a partner with you. लेकिन I would ask him, what do you think? Am I right with my conclusion? माने एक ही अवस्था में मुश्किल है. ऐसे बहुत संत महात्मा लोग मेडिटेट करके सब कुछ कर सकते हैं, लेकिन आम लोगों के लिए मुश्किल है. So this is what happens. Man has desire, gets erection, and loses it prior to penetration. The treatment aspect we'll cover next. Second is, a man has desire, gets erection, but is unable to penetrate. The penis remains stiff. Can you think what could be the cause? Sorry? Agreed. Any other? Correct. Vaginismus. Any other? Technical know-how. Yeah, बड़ा अच्छा sentence use किया. Inadequate knowledge of sexual anatomy. हाँ, माने inadequate knowledge क्या होता है? लेकिन उसको दिमाग में एवरी टाइम, स्पेशली जो न्यूली वेड भी होएगा ना, उसके दिमाग बेचारे ने कोई एक्सपीरियंस है नहीं, तो जाएगा करेगा, बराबर गया कि नहीं, तो डाउट में रहेगा. टेल हिम वेरी क्लियरली व्हेन ही कम्स फॉर द कंसल्टेशन कि देखो पेशाब की जगह बहुत छोटी है, उसमें एक उंगली भी नहीं जा सकती. टॉयलेट की जगह बहुत नीचे है, एक ही जगह पर जा सकता है, वो है वजाइना. डाउट दिमाग में मत रखो. और मुझे पूछा जाए तो मैं मेरे पेशेंट को ये सलाह देता हूँ कि जो इनएक्सपीरियंस है, आप अंदर डालने की कोशिश मत करो. Whenever you get hard on, give it in the partner's hand, because it's a woman who knows where it goes, not the man. वैसा क्यों? अरे भाई, अंधेरे में मैं मेरे मुंह में डाल सकता हूँ. डॉक्टर विजय आपके मुंह में डालने गया, इधर लगे, वाई बॉदर? कॉमन सेंस इसमें, और कुछ नहीं है संजय के लिए. ये ताली बजाई क्योंकि सब वही सफर से गुजरे हैं. वो सब सुहानी सफर से गुजरे हैं. द मोस्ट एक्सपीरियंस मैन इज हियर, डॉक्टर नाथ. फॉल्टी पोजिशंस. मेरे पास केईएम में 1 out of 10 पेशेंट्स डज नॉट नो हाउ टू. मालूम नहीं होता है. मैं मेरी ऑफिस के अंदर डॉल्स रखता हूं, भाई दिखाओ आप किस तरह से पोजीशन करते हो. कितने लोग ऐसे हैं कि जो दे वुड कीप देयर लेग्स आउटसाइड देयर पार्टनर्स एंड परफॉर्म. प्लीज रिमेंबर, coital history is not included in the Western literature. अपने यहाँ ये बहुत जरूरी है. Even in this era of internet, you will find this. Don't take anything for granted. Even if a man says, I've had this, I'm an educated person, he might be a movie maker, but still, chance नहीं लेने का. So faulty positions and coital history is very, very important in our part of the world.
People don't, newly married, they don't put on light, they are shy, and because of that lack of illumination, they might enter here, there, or
लाइट होने से थोड़ा टॉर्च लाइट मारने से थोड़ा मैं दिखने वाला नहीं. बेस्ट इज डॉक्टर साहब, गिव इट इन हर हैंड, शी नोज वेयर इट गोज. यार काय को प्रॉब्लम है लेने का, काय को लेने का नहीं, बराबर है. लेकिन पेशेंट का वो लाइट में देखेगा. देयर आर सो मेनी वुमेन who would not like to expose themselves. We are in India, we are not in US. They won't like to strip completely, no. It's their wish. On the contrary, they would become more conscious. कभी कभी आदमी को ऐसा बाहर जाने की आदत है, शौक वॉक का, तो बात और है. अभी फिल्म देख रहे हो क्या तुम फिल्म देख रहे हो, बंद कर दो, क्या करते हो तुम? He is a corporator, and there were few corporators which were found seeing this blue film when sessions were going on, but he was not there. तुम्ही नाही होता ना नक्की? आता नहीं वो नहीं था. कर्नाटका, ठीक है. हाँ, look, he takes proper care. कहाँ का था सब. हाँ, दूसरा, patient comes here, I have desire, doc, I do get erection, but there is a tremendous curvature of the penis. तो इतना कर्वेचर होगा कि वो अंदर डालने में बहुत दर्द होगा. That is the right time. And this curvature could occur because of congenital configuration of the corpora cavernosa, abnormality of the investing or buccal fascia, moderate chordae with hypospadiasis. That would be another condition. And most common, you said, is Peyronie's disease. Am I right, sir? Peyronie's disease, which is one of the most common things which most of us have seen. I remember that there is one more case which I have seen. Patient had desire, he gets erection, and he would not penetrate. This was his third marriage, married to a nurse. 2 शादी लड़कियां चली गई थी, माने they took divorce from him. तो मैं नर्स को बोला कि कोई I got his physical examination done, got his all hormone profile done, sugar, cholesterol, triglycerides, everything was normal. Even NPTR भी कराया, that was also normal. But so I said कुछ psychological problem हो सकता है. तो उसकी wife nurse थी, बोलता है डॉक्टर, he is more balanced than you and me both. बट तो मतलब क्या होता है, लेकिन सर बोलते हैं कि जब भी वो इंटरकोर्स करता है तभी पेनिस मुड़ जाता है, बकल हो जाता है. रिमेंबर दिस आर वेरी रेयर थिंग. एवरीथिंग विल बी नॉर्मल, बट ही हैज डिजायर, ही गेट्स इरेक्शन, द मोमेंट ही ट्राइज, रेजिस्टेंस रहेगा नहीं, मुड़ जाएगा. दिस इज बिकॉज ऑफ द रिड्यूस्ड एक्सियल प्रेशर. नॉर्मली एनीवेयर फ्रॉम 80 to 150 तक रहता है. अगर उससे कम आ गया तो दिस कुड बी द ओनली सी which you mentioned. Your good name, sir? Tariq. This is fracture of penis. Zeba is your wife, right? You are sure? I keep these dolls. All parts are mobile. दिखाओ भाई पाँव कैसे रखते हो. अपने यहाँ तरह तरह के लोग पाँव पोजिशन करते हैं. ऐसा लगता है कि ये लोग को ओलंपिक में भेजने चाहिए. You know, variety of positions. अगर वो he is able to penetrate and loses his stiffness, what could be the reason? एक बड़ा अच्छा केस आया था. नई नई शादी हुई थी. राजस्थान का कौन था यहाँ से? वो फ्रॉम राजस्थान. हाँ आप थे राजस्थान में, मुझे याद आया. तो शादी करते हैं तो वो लोग बहुत वो पहनते हैं चूड़ा और ये वो, और उसमें ग्लास की पहनते हैं कुछ कम्युनिटीज में. उसका बेडरूम यहाँ था और उसका फादर का बेडरूम बाजू में था. तो जब भी दैट फेलो गिव्स अ जर्क तो थोड़ा खड़ंग करके आवाज होता था. तो उसके दिमाग में तो मेरे फादर सुन लेंगे तो, फादर सुन लेंगे तो. 2 साल तक उसका सब इन्वेस्टिगेशन लोगों ने करवा दिया, कोई पूछा नहीं क्या प्रॉब्लम है. इट वाज जस्ट भाई जब भी आप करने का हो तभी हाथ में से चूड़ियां निकाल के फिर बाद में करो. ऐसा ही एक पलंग आता कॉट का था, ऐसा एक केस के ये में जब भी वो करने को जाता था तो कॉट में चू चू ऐसा आवाज आता था. तो विचार की माझ्या वडील ऐकणार तर काय काय होणार. तो उसके फियर की वजह से दैट फेलो विल लूज द इरेक्शन. अगर वो होगा तो यहाँ पर कोई ट्रीटमेंट की कोई जस्ट चेंज द कॉट, बात खत्म हो गई. वेलकम डॉक्टर साठे. Second is, sorry, unable to penetrate and penis remains stiff, curvature, chordae with hypospadiasis, pyronis and fracture. This is reduced axial pressure. Please remember, any case which you get, before implementing the therapy, any case which you get, never start the treatment unless the female partner is examined. Now we are living in our country. अमेरिका में रहा के भाई तो चलो एग्जामिनेशन करना है. The moment आप ऐसा करके ऐसा करो, woman must have dropped her clothes down. यहाँ पर ऐसा नहीं है. If woman agrees, examine in her presence. But if he does not agree, what I do is I give them the vaginal dilators. Somebody in Bangalore prepares very user-friendly vaginal dilators, which are just like rubber. It can bend, it can move. They are in different 1, 2, 3, 4 graded sizes. I ask them, you try this dilator at home. See that your husband does it for you. Put a condom on the dilator and try it. कब तक जा सकते हो? इससे 2 एडवांटेज होता है. At least you know that the fellow knows the proper direction. कहाँ डाल रहा है, इधर उधर तो नहीं डाल रहा है. So that is one. And second, a woman becomes confident. Third, it is rationally, because you need to dilate her vagina. only for that particular partner. Neighbors का वो नहीं लेने का है अपने को judgment. You have to manage for her own partner. अगर ग्रेड 3 पर आया तो ग्रेड 3 तक डायलेट करने का, ग्रेड 4 तक आया तो ग्रेड 4 तक डायलेट करने का, बिकॉज penile length and width differs from one individual to the next as to the length of the noses, the width of the forehead, and size and spacing of the eyes. So different people have different penis sizes, and I have not come across so far an individual कि मुंह देख के बता दे कि प्राइवेट पार्ट की साइज क्या होगी. I have not come across, and this is not true also. हाँ जी sir. Yes sir. Thank you. No. Okay, I'm sorry. Huh? After 5 minutes. Dr. Maldev was worried that some people said, "Abhi is high time for a cup of coffee." मैं बोला ठीक है, but 10-15 minute का time है, इसके बाद we'll break and then we'll take that. Is that all right with you? चलेगा? So you must rule out obstructive vaginal pathology and vaginismus. Vaginismus is a condition where a woman gets tremendous involuntary spasms in the outer 1/3 of vagina, where the entry of penis becomes impossible. Investigations in erection, hemogram, most common diabetes, blood sugar needs to be ruled out, lipid profile, because that will give you an idea of the atherosclerosis, hormones, prolactin, testosterone, and if an individual is more than 45, ask for PSA total. For PSA total, he doesn't need to go fasting. Am I clear? 0 to 4 is supposed to be normal. Or at least put a finger in the rectum, because if you plan to give any hormones, because this is known to precipitate occult or microscopic cancer of the prostate gland. Other spatial investigations could be NPTR, nocturnal penile tumescence rigidity, which measures the rigidity and the time of sustenance. There are 2 electrodes, one at the level of coronal ridge and second at the base. Individual sleeps. Every man gets erection 3 or 4 times at night. That is being recorded, so you can judge. This is valid even in the court of law. Second is Doppler, especially and PBI, to rule out any plaques or vascular supply. Electromyography in case of any myopathies. There will be a delayed thing. And intrapenile injections could be another thing by which you can find out. Penetration. Situational after penetration. Any distraction can lead to erectile dysfunction. Any distraction, even on the simple knock on the door. And next time you can anticipate this. Constitutional dorsal nerve pathology. We have not seen any case. We have just read it in the book, and some person has reported that this was the cause. Second thing is sexually transmitted infections. Sometimes if there is a stricture or if there is a bubo or any reason which gives you pain on thrusting, your erection can decline. Another thing, in our KEM hospital, most of the patients from the obstetric ward were referred to us. Doctor साहब, desire होता है, erection होता है, लेकिन afterwards he loses the erection after penetration. That is because in normal deliveries, there is vagina becomes lax because of the normal delivery, because penis is this big and bacha is this big. The whole thing, the elasticity is lost. So sometimes there could be lax vagina, could be the very, very common thing. How it will occur? Clear in your mind. कैसे होगा भाई? Suppose if you want to masturbate, what is मेरे पास पेशेंट आता है, मैं उसको बताता हूँ. Is intercourse? Suppose if I have to clear the guilt of masturbation, how would I clear? Before beginning of my career, I used to give a talk, बड़ी अच्छी language में, just like psychiatrists talk. You know, there's no other activity which has been so roundly condemned, so frequently discussed, and yet so universally practiced than masturbation. Masturbation is beneficial and not harmful. It's one way by which one can avoid unwanted pregnancies and sexually transmitted diseases. And in my opinion, if masturbation were to be suppressed, cases of crimes against morality would enormously increase. There would be a great, सब लोग ताली बजाते हैं, क्या लगाया, क्या डॉक्टर ने लेक्चर दिया, भगवान कसम एक पेशेंट अच्छा नहीं हुआ, डॉक्टर नाथ तुम्हारी कसम एक पेशेंट अच्छा नहीं हुआ, KEM तो फ्री हॉस्पिटल था, सब चक्कर मार के वापस आ गए डॉक्टर, बस लेक्चर तो बड़ा अच्छा दिया लेकिन अभी तक वो गया नहीं. Then I thought I'll have to change my modus operandi. I changed it, and believe me, after that I've yet to come across a recurrence. पूछता हूं मैं, आप भी ठीक लगे तो अपना सकते हो. इंटरकोर्स से कुछ तकलीफ होती है? नहीं डॉक्टर. मास्टरबेशन से? हाँ डॉक्टर. During intercourse, what the penis does in a woman's vagina, it does the same in the folded palm during masturbation. माने अगर आपको संभोग के वक्त जो इंद्रिय योनि मार्ग में करती है, वही चीज हस्त मैथुन के दौरान मुट्ठी में करती है. इसका मतलब सेम थिंग है. इसका मतलब अगर आपको हिंदी आता है तो मैं मराठी आसानी से सिखा सकूंगा, नहीं काय पेटकर, हाँ, कारण के लिपि एक है. लेकिन डॉक्टर साहब ज्यादा किया तो? ज्यादा का मतलब क्या? ज्यादा बोलने से जबान कमजोर नहीं होती, चुप रहने से जबान ताकत वाली नहीं बनती. लेकिन डॉक्टर साहब जबान और इसमें देखो, जबान में भी ज्यादा खून है, प्राइवेट पार्ट में भी ज्यादा खून है, जबान में भी हड्डी नहीं, प्राइवेट पार्ट में भी हड्डी नहीं, जबान भी सेंटर में, प्राइवेट पार्ट भी सेंटर में, खलास. पेशेंट अच्छा होना चाहिए, बातें बताने से कुछ नहीं होता है. एक पेशेंट वापस नहीं आया उसके बाद, चाहे वो महाराष्ट्र से रहे, गुजरात से रहे, यूपी से रहे, साउथ से रहे, कर्नाटक से रहे, कहीं से भी, कोई वापस नहीं है. एग्जाम्पल अभी वो साउथ का आएगा तो आई विल यूज तमिल एंड मलयालम लैंग्वेज. अंग्रेज आया कोई अपना नाथ जैसा तो इंग्लिश एंड फ्रेंच बोलूंगा, पेटकर जैसा आया तो मराठी और हिंदी बोलूंगा, वो थोड़ा चेंज करेगा. बाकी on the same note, can you masturbate with the loose end? Yes or no? No. Same thing happens with the woman. If her vagina is less, the penis will get shriveled up. Am I clear? पक्का? हाँ जी, हाँ जी. You differ? Fine. Vagina is? बट मेरे बाप इतना बड़ा हो गया है तो कैसे रहेगा? मैंने टेम्पररी, वो टेम्पररी की बात करता हूँ ना, परमानेंट की बात नहीं. टेम्पररी उस वक्त ऑब्स्टेटिक्स में से आ जाता है. भाई ऐसा ऐसा होता है, नहीं होता है. अभी इस वक्त ट्रीटमेंट बड़ा आसान है. मैं आपको बताऊं, सिंपल ट्रीटमेंट है. अरे आप इंटरकोर्स नॉर्मली करते हो मेल अबव पोजीशन में, वो मेल अबव पोजीशन में आपने किया, फिर दोनों पांव ऐसा करके क्रॉस कर देने को बोलो लड़की को, तो द ग्रिप वुड बी बेटर. पहले का जैसा ही ग्रिप हो जाएगी. जब तक वजाइनल मसल्स आपका कॉन्ट्रैक्ट नहीं होता है आपकी पार्टनर का, तब तक ये पोजीशन करोगे तो प्रॉब्लम सॉल्व हो जाएगा. उसमें दवाई देने का, PDE5 देने का कोई मकसद नहीं है. It's a common sense and it works very well. मैं अपने तजुर्बे से बात कर रहा हूँ। कोई पेशेंट ऐसा आया तो बेचारे ऐसा हो सकता है, कई बार वजाइना लैक्स हो जाता है, कई बार एक्साइटमेंट के अंदर इनर 2/3 ऑफ द वजाइना गेट्स ब्लोटेड अप 3 times in the normal size. क्या करोगे? This is the simple position. I believe in one thing: when the problem can be solved without the drugs, why use the drugs? ये आपको क्लैरिटी देने के लिए पेनोवजाइनल कॉन्टैक्ट. Investigations: rigidiometer for reduced axial stability, Doppler for penile disease, vaginal examination for vaginismus, obstructive vaginal pathology, and laxity. Put a finger and ask her to contract her vagina. अगर आपको लगा कि नहीं कॉन्ट्रैक्शन कमी है, कीगल्स एक्सरसाइज उसको बोल दो करने के लिए 10 बार सुबह 10 बार शाम को, तब तक बेचारे को लेट हिम एंजॉय. व्हाट डू यू लूज इन दैट? वो एंजॉय करता है तो ना, वुमेन्स लेग्स क्रॉस पोजीशन के अंदर एटलीस्ट लेट्स हैव हिज फन. एम आई क्लियर? एम आई क्लियर? Orgasm. What happens when a man reaches orgasm? You see, fluid from the testes, seminal vesicles, and the prostate gets deposited into the prostatic urethra. There is simultaneous closure of the bladder neck. Here you experience a stage of ejaculatory inevitability. I would call it orgasmic inevitability. क्योंकि अगर ejaculation नहीं होगा तो भी you will feel that. तो भी you will feel that. And after that, a split second later, there is a contraction of the bulbocavernosus and the ischiocavernosus muscle, and the seminal bolus is thrown out in jerks. And a man experiences pleasure. Remember, orgasm can occur without ejaculation, and ejaculation can occur without orgasm. Don't use the word premature ejaculation, because orgasm is experienced between the 2 ears and ejaculation is experienced between the 2 legs. In women, vaginal contractions are experienced between the 2 legs, but the pleasure is between the 2 ears. So divide this in 4 ways. I object to the term premature ejaculation. The reason is orgasm can be either early, can be late. What happens when a man reaches orgasm early? Sir?
The excitatory phase and severe decline, and orgasm comes much faster.
Orgasm, then why do you call premature ejaculation?
The orgasm comes faster.
So that is early orgasm.
Yes, that's right.
Not delayed, not premature ejaculation.
There is something called premature, there has to be something called post-mature.
No, something called mature. The moment you say premature ejaculation, you are propagating a myth that ejaculation and orgasm are synonymous. In reality, they are distinctly different and one could occur without the other. Moreover, those people who reach orgasm much earlier, say for example, prepubertal boys, they don't ejaculate at all. Those people who are elderly people, they reach orgasm, but there is no ejaculation. Those people whose prostate has been removed, there is no ejaculation. Those people who are on tamsulosin or carbamazepine for a long time, they reach orgasm, but there is no ejaculation. Those patients who has got blocked ejaculatory duct, there is no ejaculation. फिर भी वो जल्दी आएगा तो हम लोग सब बोलेंगे भाई premature ejaculation. अरे, there is no ejaculation. Just because we are aping the West. Think. And Even in your DSM-5, people follow blindly because it's the Western. We are aping the West. Suppose if there is delay in reaching orgasm, what do we call? Retarded ejaculation. Can ejaculation ever be retarded? It's a retarded thought. It's a delayed orgasm. So orgasm is in the center. Otherwise, you will confuse yourself. You see, orgasm can be early. Orgasm can be delayed. You reach orgasm, but there is less pleasure. So orgasm can be impaired. And we reach orgasm, but there is no pleasure at all. Orgasm could be absent. Pleasure could be absent. There is no fifth thing beyond this. I convened the 7th World Conference of Sexology first, and then the first ever international conference in 1991 on orgasm, just to make the world believe that orgasm and ejaculation are different. लेकिन जैसे यहाँ पर 1 drop of semen equals to 100 drops of blood, and 1 drop of blood equal to so much of food, I also grew up with this, and I had that till the age of my 50 years. वही misconception, कभी कहाँ खाएगा तभी ये सब जमा होएगा. Same misconception is being carried by the DSM-5 people. I am telling you on this record, and the Western world, that ejaculation and orgasm are synonymous. In reality, they are distinctly different, and one could occur without the other. So orgasm में 4 type हो सकती है: early, delayed, impaired, absent. Simple definition: if an individual reaches orgasm earlier than his expectation, it's early orgasm. If it reaches with a delay, it's delayed orgasm. If it reaches but there is less pleasure, it's an impaired orgasm. And if it reaches but there is no pleasure, it's an absent orgasm. खलास, पांचवा कुछ चीज हो ही नहीं सकता है. तो ये हमारे, I did my PhD from this, and the maximum cases which were referred to me was by Dr. Ajit Phadke and F.P. Sunawala, and I could not place them in the existing diagnostic nomenclature. Yes, sir. Please, please. Females never ejaculate.
Check.
And the male partner ejaculates earlier than she expected. How can we tame that?
Suno. I'll tell you one thing. What is important? आपको आपकी female partner को orgasm पे लेके आना है. Devote some more time in the foreplay. थोड़ी मेहनत करो यार. Take her to climax, and whenever you get hard on, give it to her. Suno. What is important is reaching the climax.
Yeah.
Simultaneous climax. दोनों साथ में ये जरूरी नहीं है. वो समभोग होना चाहिए. समभोग. वसंत साठे gave a beautiful definition of समभोग. जो सम से जो भी बात हुई है संस्कृत में वो बहुत अच्छी है. संवाद, अच्छी बातचीत. संगीत, अच्छा गीत. उसी तरह से संसद, where good people are supposed to go. उसी तरह से समभोग माने कंसेप्ट ऑफ इक्वालिटी एंड म्यूचुअलिटी. दोनों को संतोष मिलना चाहिए. आगे पीछे मिले इसका कोई दिक्कत नहीं. और ये प्लेजर जो है तुम्हारा खुद का है. मास्टर्स एंड जॉनसन का डेफिनेशन: इफ अ मैन रीचेस ऑर्गेज्म earlier in 50% of the intercourse experiences and does not allow his partner to climax in 50% of the intercourse experiences, he is tabbed as a premature ejaculator. My question would be, suppose if your girlfriend takes half an hour or 1 hour to reach climax, why should you be blamed? Partner needs to be treated.
Yeah, I agree, sir. That is what is my point. Mostly in my clinic, female partners are bringing the spouse. Their complaint is that they are not getting orgasm through this man. That means male partner, because of he ejaculates. In their words, I say, he ejaculates like chicken, that means murgi. Murgi kaise काम करता है ऐसे करता है. In our language, कोड़ी का काम, कोड़ी. That means it is they ejaculate earlier. That means
No,
within a second.
remember, not ejaculate, they reach climax earlier.
No, that means
Or they reach orgasm earlier than
Yeah,
their
yeah.
partner.
the main.
So there are two things. Either the partner needs to come early or this man needs to get delayed.
No,
आप आराम से जितना चाहिए उतना डिले कर
I
सकते हो.
agree with you, sir. But we must look to the female partner also.
But-
Their complaint is that with this man, I am not getting the orgasm. With someone else, I am getting the orgasm. How can we solve that?
सर
problem?
सिंपल, अगर वो नहीं वो his question is valid, your question is valid कि she is experiencing climax with one person because he is taking longer time.
Yeah.
Other person is reaching climax earlier.
Yeah.
So there are two options.
Yeah.
Either the male needs to delay,
Yeah.
or the women needs to come faster.
Yeah. That is what I am doing.
No. You are doing means what? You have to tell
No,
the
no.
patient. You don't
I'm
have to do.
advising them.
Okay.
I am advising them.
Why, it's a corporator इधर है मारेगा आपको. And remember, this is the only classification which has got male and female orgasm. I mean, male and female parallelism. लड़कियों को भी अर्ली ऑर्गेजम होता है, डिलेड ऑर्गेजम होता है, impaired orgasm होता है और absent orgasm होता है. Please remember, women do not ejaculate as men do. मेरे पास 2 या 3 केसेस आज तक लाइफ में आए हैं, copious ejaculation, but that is not normal. By and large, women do not ejaculate as men do, but they do experience orgasmic pleasure, and the pleasure is experienced between the 2 ears and not between the 2 legs.
True, sir.
Mane ejaculation word you should not use. If you use this word, things become, you will be able to diagnose case properly. बोलता है मेरे को जल्दी पानी, मेरे को I come early. आप क्या करते हो डॉक्टर? ejaculation तो होता ही नहीं. You are dealing with a case of early orgasm.
No, I am not following Western or DSM-5. In my actual practice, patients complaint.
I understand that you are very sympathetic and you are very kind, but still, patients do complain. So there are 2 options. Either you delay his climax,
That
or
is what, with the
make the part, and this can be possible, which will be there after in the next session. How to delay the male's climax.
Thank you, sir.
No, pleasure. I like. You see, a gem cannot be polished without friction. All questions are welcome. Early orgasm, if it has started from the beginning or late, primary or secondary, sugar needs to be ruled out. It could be a presenting symptom. Second, routine urine infection could be the cause. And prostatic fluid examination, especially if the early orgasm problem has started later on in life, if it's not primary. Delayed orgasm, hemogram, blood sugar, hormone deficiency can lead to this. Also, per vaginal examination of the partner to rule out the laxity of vagina. Impaired and absent orgasm, I have found sometimes B12 deficiency. Though B12 levels are normal, I have found that giving B12 helps in improving the contractions. For a couple of months, try, and if it improves, you are lucky. These are difficult cases. Testosterone deficiency can be the cause. Sonography of prostate seminal vesicles using a rectal probe. And if at all there is problem in the muscles, especially the group of muscles, gluteal muscles, you will find problem with the electromyography. Investigations are required. Please remember, in the pursuit of orgasm, ejaculation is a happening and not a prerequisite. ऑर्गेजम के लिए इजैकुलेशन का जरूरत नहीं है, वेजाइनल कॉन्ट्रैक्शंस का भी जरूरत नहीं है। हाँ, इजैकुलेशन आ गया। इजैकुलेशन is not necessary for the human sexual response cycle, but you can diagnose cases from ejaculation. कैसे? एक आया, as you know that sperms, seminal vesicles and the prostate deposit the fluid in the prostatic urethra. There is simultaneous closure of the bladder neck which prevents semen going from the to the bladder. There's contraction of the bulbocavernosus and ischiocavernosus, and the seminal bolus is thrown out. Now, if at all there is a problem in the bladder neck, the ejaculation would be retrograde, where a patient will come, doc, I have desire, I do get erection, I'm able to penetrate, even if I masturbate, I reach orgasm, but there is no pleasure at all. I mean, there is no ejaculation outside. So this could be retrograde ejaculation. Ejaculation is in the bladder. It's called as, also known as a dry run. कई बार पेशेंट आएगा, डॉक्टर सीमेन जस्ट सिप्स आउट, इच्छा होती है इंद्रिय खड़ी, सबको इंटरकोर्स के टाइम मजा नहीं आती, सीमेन जस्ट करके निकल जाता है. सस्पेक्ट मायोपैथी. सीमेन डज नॉट कम आउट एट ऑल. रेट्रोग्रेड इजैकुलेशन. Absent ejaculate, especially following certain operations, prostate operations. Patient is on carbamazepine or tamsulosin for a long time, or a blocked ejaculatory duct. Keep it in the way. Semen comes out in less quantity. Partial retrograde ejaculation. Low testosterone level. Semen comes out after a while. Doc, I have desire, I do get erection. I'm able to penetrate, I reach orgasm. But semen does not come out immediately. I get the pleasure. But semen comes out after a while. What could be the condition? Thing. Pouch in the bladder, in the urethra. He will give the history कि मैं ऊपर से नीचे गिर गया था और मेरे को यहाँ लगा था, या तो कोई डॉक्टर ने डायलेटेशन करने के लिए थोड़ा इंस्ट्रूमेंटल किया है तो वहां एक खड्डा बना दिया है. तो सीमेन कम्स आउट, बट इट कम्स आउट आफ्टर व्हाइल, राइट? Investigation, serum testosterone, urine after orgasm for sperms to prove retrograde ejaculation, sonography of the prostate, seminal vesicles and the blocked ejaculatory ducts, EMG for myopathy and squirtless seminal dribble, and the last, pouch in the urethra. Advise them to do ascending urethrophy and you will find pouch is very clear. Please remember, physical examination, as I told you, pulse rate, blood pressure in lying down and standing position. We are just summarizing it. Testes manufacture testosterone, gets metabolized in the liver. Look for the gynecomastia, hair growth. Second, femoral pulsations go down. Take the penile blood pressure. That is known as penobrachial index, less than 0.6. Abnormal, more than 0.75. Normal, anything in between. PDE5 can be the things. Foreskin retraction, chamadi piche le sakta hai ki nahi. If he is not circumcised. Penile and perianal sensations to rule out S23, just an. And second, BC reflex and cremasteric reflex, once again, S23, S234. Ankle jerk to rule out thyroid. This completes your physical examination, period. Agar aap 9 out of karoge, 90% of the cases, you will be able to clinch the diagnosis. Previous slide. This one? This one? Ascending lithography लिखा है? नहीं, pylography sir. Pylography है.
No, pylography, you are demonstrating the ureter and pelvis of the kidney. When we want to delineate the urethra, we have to inject the dye in the external meatus. Then take, that is a urethrophy. Sorry, here it is written pylography.
Oh, yes, right.
Urethrophy.
Right. Thank you. Thank you, sir. Your good name?
Dr. Rajendra Singh.
You must be a surgeon.
Yeah.
No wonder.
Thank you, sir.
God bless you. हाँ, सर ये है ना, अभी एक जान 100 तूफान उसके लिए लगा दिया है. Absolutely ascending urethra. Pyelography किधर से आएगा? उधर किडनी थोड़ा आएगा. बहुत ऊपर है. Please give us 3 cheers for Dr. Rajendra Singh. आप आए तो ख्याले दिल नाशाद आया, कितने भूले हुए जख्मों का पता याद आया. Yes, sir, please. Sorry? Ankle jerk, sir.
Sorry, ankle jerk.
It's a thyroid, to rule out thyroid.
Blood test can.
Blood test can help better. But when you are doing a physical examination, खाली एक jerk मारने का है. आपने cremastic ले लिया, just a hammer on the ankle. And by chance, if it is absent, you could be a little more cautious. Suppose if there are no blood examination, and if you want to diagnose, then this would be the thing. It won't take more than 5 minutes. Your good name, sir?
Dr. Natesh Prabhu, sir. From
Thank
Trichy.
you, Natesh. Thank you. You are from?
Trichy, sir. Trichy.
Cochin?
Tamil Nadu.
Oh,
Tiruchirappalli.
Tiruchirappalli. Okay, okay. Thank you. हाँ जी. Right, sir.
PBI.
हाँ जी.
Yeah. Physical examination.
Physical examination में PBI सर एक Doppler रहता है. उससे you take the blood pressure of the penis. There is a small cuff, and you come to know immediately when a systolic blood pressure of the penis divided by systolic blood pressure of the brachial artery gives you a pinobrachial index. Instead of once, I normally do it 3 times.
But in the erect position.
नहीं sir, flaccid
In
position.
flaccid
Erect
position.
कैसे करेगा
Yeah.
sir? नहीं. Erect कैसे है?
So in flaccid position.
In flaccid position only.
Yeah.
ना इरेक्ट मस्ती नहीं करने का है अपने को कोई. हाँ ना वहाँ डेंजर आदमी
No, no. The penile Doppler before erection and after
नहीं
erection.
सर. Usually you give inject,
Injection pepe.
but ये injection नहीं करने का है. अपने को flaccid करने का है.
Yeah,
flaccid.
that's the thing. Because the physical examination, that is the basic examination.
Yes, sir.
And just,
We are doing basic only,
yeah.
and this is a screening test,
Yeah.
and you will be able to find out.
Yeah.
You are right, absolutely. But 100%. उसको how can you ask a person to have erection? ऐसे इतना खड़ा करो, ऐसे थोड़े आदमी खड़ा हो सकता है खड़ा.
But
कर नहीं सकता.
you can ask the penile Doppler in erect position, right?
Huh?
You don't say him that I cannot do in flaccid.
No.
I want to do in erect also in penile Doppler.
No.
You will not say that like this.
सर
I
वो
can do.
उसमें इंजेक्शन दे के करते हैं.
हाँ.
वो यूजुअली इसका जरूरत नहीं रहता है. You come to the reasonable conclusion of PBI,
Yeah.
and by and large you come to the conclusion where there is vascular insufficiency or एक के बाद अपन 3 बार करते हैं.
Yeah.
You won't give, I mean, instead of sending it to NPTR, I found this test to be very useful.
Good. Okay. Thank you.
No, sir.
Yeah.
Pleasure. Your good name, sir?
Dr. Sanjay Erande.
Sanjay
Erande
from
Pune and Mumbai.
Oh, Pune. Achha, good. You
Thank
must
you.
come
Thank
and
you.
meet me. Thank you, sir. सर तुम कुछ मस्ती करने को जाओ तो मुश्किल है, नहीं तो कोई मुश्किल नहीं है. You don't fiddle around with the penis. You have to just do that. इतना तो कफ होता है, इतना कफ थोड़ा ही होता है. कैसी बात करते हो यार? नहीं ऐसा आज अब केईएम में आज तक कोई पेशेंट ऐसा नहीं आया कि जिसका हम नहीं कर सके. थोड़ा जरा मेहनत करना पड़ेगा. And just before doing, just not play around, but just see that you touch and make it clear वगैरह. जरा स्क्रोटम बॉटम तपास के बाद में करो तो थोड़ा जरा टच की वजह से थोड़ा बड़ा हो जाएगा. अगर तुमने कुछ पेशेंट को दम मारा होगा तो एंजाइटी की वजह से श्रिंक हो सकता है. ठीक है, ऐसा तो तुम मस्ती. हाँ जरूर सर. कहते हैं मुसव्वर का मतलब है चित्रकार. कि क्या सुनिए राजेंद्र सिंह, कि क्या खूब नहीं, क्या खूब उतारी ये मुसव्वर ने तस्वीर, देखी न सुनी ऐसी तो प्यारी तस्वीर, जब हाथ लगाता हूं तो जी डरता है, कहीं कुछ कह न बैठे ये तुम्हारी तस्वीर. So this is physical examination. I'm telling you, I have tried to amalgamate almost all branches, right from surgery to gynecology to endocrinology to all. So it's a little dicey branch, but you can connect better. Other details like personal history, past history, family history, autonomic nervous system history like postural hypotension, enteropathy, neuroarthropathy. But there's no point. अभी कोई homosexual आया तो उसका family history क्या लेके करोगे तुम? There's no point. I mean, just because it is mentioned in the literature. Yeah, most important 4 things. Whether you are coming for the treatment is the act of instinct or one of reason. क्यों आते हो मेरे लिए ट्रीटमेंट के लिए? खुद आते हो तो प्रोग्नोसिस इज गुड, घर में से सबने बोला है, बीवी बोलती है इलाज करो, then the prognosis may not be good. Second, what arouses you the most? जरूर पूछना हर एक पेशेंट को. क्यों? अरे you will be able to clinch the diagnosis of a fetish कि जब तक मैं पाँव नहीं देखता हूं मेरे को इरेक्शन नहीं आता है, बात खत्म हो गई. और homosexual, unless and until I think of a man, I don't get erection. तो पूरा लंबा हिस्ट्री लेने का ही जरूरत नहीं, डिजायर में ही आप यहाँ पर आ जाएंगे, हिस्ट्री टेकिंग में ही. एंड व्हाट डू यू एट्रीब्यूट योर प्रॉब्लम टू? अगर पेशेंट की आप ट्रीटमेंट भी कर लिए, लेकिन ये क्वेश्चन जरूर पूछना, इरेक्टाइल डिस्फंक्शन की ट्रीटमेंट करने के बाद भी उसके दिमाग में रहेगा मैंने हस्तमैथुन बहुत किया है तो वापस मेरी गड़बड़ फिर से हो सकती है, वापस ये हो सकता है. तो ये लर्किंग एंजाइटी जो है आपको क्लियर करनी है, अदरवाइज द फेलो विल नेवर बी एबल टू एंजॉय सेक्स इन अ मैनर which he deserves to. And the last, is there anything which I have not asked but you would like to tell me? ऐसा एक पेशेंट आया था उसके वाइफ के साथ, तो लोग सब 4 साल हो गए हम लोग साथ में रहते हैं, we love each other, we kiss each other, we press each other, we embrace each other, we have a tremendous relationship, we hug each other. ऐसे what's the problem? बताओ, खाली इरेक्शन नहीं होता है, ये होता है. तो सब हिस्ट्री लिया, एवरीथिंग वाज नॉर्मल. तो लास्ट में एक क्वेश्चन पूछा, इज देयर एनीथिंग व्हिच आई हैव नॉट आस्क्ड बट यू वुड लाइक टू टेल मी? अब बोलता है डॉक्टर साहब एक ही प्रॉब्लम है. क्या है प्रॉब्लम? बोलते हैं खाली ये प्रॉब्लम घर में ही है, माने बाहर जाता हूं तो नहीं है अभी. So that means पूरा मैं इन्वेस्टिगेशन लिखा था सब फाड़ के फेंक दिया. So these questions are important. एक अनदर टिप आपको दूंगा मैं. This I have learned from Ayurveda. I had an occasion, I had a fortune of treating many who's who of the world because my specialty in orgasm. I was inclined towards Ayurveda also. Before taking up for the treatment, all Ayurvedic physicians ask कि तुम्हारा रोग आम माने with impurities है या निराम है, माने without impurities. If at all it is arm with impurities, they will never start the treatment because you can't paint on a dirty cloth. Bhagbhat कहता है. The cloth has to be clean. तो वही paint लगेगा. How will you find out? Tongue. It will be coated in arm and the stools will settle down. Ideally, the stool should float and the tongue needs to be clean. This is how you will find out whether your bimari is arm or niram. Best is to start treatment in the niram stage. These were a few of the Ayurvedic authorities whom I have encountered, which I have learned. So I thought I would share it with you. Well, at the end and the passing, I would like to say that to diagnose a sexual disorder is not magic. It's not easy. It's challenging to both physicians' own therapeutic skills and his comfort with the subject of sexuality. Much has been omitted in this talk. And it's fervently hoped that nothing has been included which ought to have been omitted. I thank you. We break for coffee.
Your last book is like suspended animation.
What is it? नहीं नहीं
उसका implication
हाँ जी
All are requested to take their seat back in 20 minutes. Huh? Dot 20 minutes, we will be resuming the workshop. Please obey the timeline. Thank you.
हाँ અહીંયા મૂકી દઉં કે બંધ કરી દો થોડો વાર आपने म्यूट किया बहुत अच्छा थैंक यू हाँ जी
I have something regarding penetrable rigidity.
हाँ
Penetrable is adjective for something.
requesting everyone to occupy your seat again. The workshop resumes within couple of minutes. To you for writing the notes. So if you want, we have now the pads kept in front, so you can collect. You can collect. The pencils used to be there, but I think you manage with your own pen. So how are you finding the workshop? Thank you. So our motive and aim to organize this workshop seems to be quite successful, and we wish that you carry home very concrete knowledge which you can apply in your clinical practice. And this was possible because of the generous sponsorship that we received from We Ridge Life Sciences, which is a company focusing on sexual medicine through the Ayurvedic modalities and Ayurvedic therapeutics. They have a nice range of products, both for male and female desire disorders and even the performance disorders. The orgasmic disorders should also be taken care in short time. So we thank We Ridge Life Sciences for their generous support for this conference. We have Mr. Ramesh Khandale, Sagar Khandale coming from Pune, You can meet him, interact him. He will also love to interact with you during next 2 days in the in our exhibition hall. So we are thankful to Virij Life Sciences and Khandaya sir for his personal efforts to make this successful. Okay. Thank you. Thank you, sir.
Thank you.
So after a brief coffee, tea break with some cookies, some calories have been gathered. So we request Kothari sir to resume. And before that, I request Dr. Kedar Padte. He is a renowned gynecologist, leading gynecologist from Goa. He wants to share some shairi from his side in recognition of Dr. Kothari and his efforts for today's workshop.
Sir, no competition, just compliment. First of all, thank you so much for a fantastic workshop. And I have known him for last 30 years. I have referred many patients to him in Bombay. And I'm a practicing gynecologist from IVF person in Panji, Goa. But we did not have anyone who would treat these disorders, and automatically many of them went to him. Like the Virij Pharma is now supplying Ayurvedic medicines also, which were used primarily at that time only as Ayurvedic medicines, with very few people kind of supporting and specializing in sexology like he did. And now, of course, Dr. Shirish Malde comes to our hospital also. So those days, they used to use Ashwagandha and Shilajit, right? 40 years back. And the person who used to bring used to be somebody who had a joli in his hand and used to come with Shilajit, and he says, for all your erectile problems, a little vulgar, he says, Shilajit khayega, patthar pe marega, to ton bolega. Well, I didn't come to tell you that. I came to say that if you want to have good sexual relationship with your wife and you find that there is a problem with communication, then there is one shairi which goes a long way. And that is what I will say before I leave from here. And the shairi goes like this. Ay chand, tu gurum na kar. I'm saying to my wife. Ay chand, tu gurum na kar. Humne bhi chand dekha hai. Par tujh pe to daag hai. Humne bedaag dekha hai. Thank you very much and all the best for the workshop.
Thank you, Dr. Kedar Padte sir. Thank you. He has been of a great help as a local organizing person from our organizing committee in organizing this workshop as well as the conclave. So, Dr. Kothari, requesting you to resume the workshop. Thank you.
Good afternoon once again. There are two subjects which I wanted to cover. There are two subjects which I wanted to cover. ठीक है? नहीं होगा तो भी चलेगा. पूरी दुनिया आने जाने पे पेट करता. नादान पंछी को शिकारी की ताकत का अंदाजा नहीं. हाँ. Can I start? Am I audible? I've got two topics in my mind. One is whatever diagnosis we have done, what treatment we can offer. That is one. And second is utilitarian approach. What I do is on day one, I take the detailed history. Then on day two, I explain to the client what is his problem. I clear the myths and misconceptions, offer him adequate knowledge of sex and sexuality to combat sex anxiety, tell him exactly what I think is his problem and what needs to be examined and why. So here the patient feels confident that my doctor has understood my problem, hence he'll be able to solve it. This is known as a positive transference. So that is one, and this is two. Which one you would like me to cover first? This is known as the utilitarian approach. There are 10 slides. You can explain any problem in these 10 slides. Your choice. Utilitarian approach. Utilitarian approach. Third chapter. Okay. I have some booklets which I have bought. This can go handy. No, you sit down. Just सबको दे दो. सब आपको खड़े होके दे दो.
Yes, sir.
You just distribute among all. बैठो उधर, आराम से बैठो. बैठो. Let us ask, first of all, what types of problem do you come across? I would like you to participate. Come on, I'm going to touch only to those things which problems you come across in your clinical practice. कौन से cases आते हैं आपके पास? हाँ जी, erectile dysfunction. एक मिनट. हाँ भैया, erectile dysfunction. Then premature ejaculation. Yes. Desire. Wet dreams, very good. Sleep emissions, very common. You are right. Wet dreams. Yeah, fast. We don't have. Come on. That syndrome. Yes. Unconsummated marriage. Vaginismus. Low libido in females, okay. Sorry? Sex tonics you are telling. Okay. Anything else? Which are the other cases you come across? Huh? Yes?
Most people had a normal life.
Yes.
Till a young person of whatever age he has infarct. And post-infarct, everything changes. The spouse is scared that if they have...
So, sex after heart disease. Anything else? Sorry? Pyron is curvature, okay. Sorry? Porn, oh. Sorry? Masturbating. Masturbating, yes. Penis size. Penis size. Okay. LGBT. Yeah. You tell me all the problems. Sorry? Performance anxiety. Okay. Anything else? Right. Anything else? Penis size? 1 second. Sorry? STI. Sorry? Of the partner, female partner. Sorry? Sex of? Anything else? Sorry? Phobia. Fine. But any particular problem per se?
Precocious puberty.
Puberty. Anything else? Yeah? Deviation. ठीक है? Sorry? हाँ जी?
Hypersexuality.
Hypersexuality. Anything else? हाँ जी?
After COVID vaccine.
After?
COVID vaccine.
Okay. ठीक है? Suppose if you were to have, if I am seeing a patient who is sitting here, he is consulting me. I have taken a detailed history from him. He is having so many problems, all these problems. If I have to educate him, I have to clear his myths and misconceptions. I have to offer him adequate knowledge to combat sex anxiety. I have to motivate him that I am going to examine him so that he allows me to examine him. At the same time, he understands that my doctor has understood my problem, so he'll be able to solve it. And there is a positive transference. If this is the situation right in front of me, I call this as a utilitarian object. I mean, utilitarian problem. This is my own. It has helped me a lot. भाई ये चलता नहीं है दोस्त. The meaning of utilitarian is very simple. There are two meanings. One is a dictionary meaning and another is a thesaurus meaning. Dictionary meaning means practical and not just beautiful. Thesaurus meaning is realistic and not illusionary. Bhai chalta nahi, not just. Huh? Thesaurus meaning is this. This session helps you in clear the myths and misconceptions. Offers you adequate knowledge of sex and sexuality to combat sex anxiety. Explains you how and why of the examination. Identify his or her problems. And there is a positive transference. I've given you a note, a small booklet, which has got all 10 slides. I've been using this day in and out. It contains education, counseling, therapy, and if possible, even research. First slide is this. How I would explain to you. Sir, this is how a man gets erection. I'm educating my client who is only one person sitting in front of me. When there is more flow of blood inside, a man gets erection. With the lessening of flow of blood, there is a flaccid state of penis. It means erection totally depends upon flow of blood. If a man comes and reports to me, the doctor, I have had a stiff erection once in last 3 months, good enough, that confirms that physically there is nothing wrong with him. मैं मेरे पेशेंट को इस तरह से समझाऊंगा कि देखो भाई, ये मेरा हाथ है, यहाँ से काट के नीचे रख दिया, 10 मरतबा इसको उठाऊंगा, 1 मरतबा भी उठेगा नहीं. अगर एक मर्तबा उठ गया तो आप मानेंगे कि मेरा हाथ टूटा हुआ था? नहीं मानेंगे. Meaning thereby, if you get erection in one set of circumstances and not in the other, the problem is situational and not constitutional. Clear? Yes or no, yaar? हाँ. Second thing about masturbation. Masturbation एक normal चीज है, because during intercourse, what the penis does in a woman's vagina, it does the same in the folded palm during masturbation. If you know Hindi, you can pick up Marathi faster because of the same script. There's nothing like excess in masturbation resulting in weakening of the penis, because the tongue does not become weak in a talkative person, neither does it become strong if one observes silence. अरे लेकिन डॉक्टर साहब मास्टरबेशन करने से हमारा तो इंद्रिय थोड़ा टेढ़ा हो गया. व्हाट डू यू मीन टेढ़ा? दुनिया में कोई आदमी ऐसा होता नहीं है कि जिसका इंद्रिय टेढ़ा होता है. किसी का इंद्रिय 90 डिग्री का कोण नहीं बनाता है, थोड़ा लेफ्ट पर हो या राइट पर. एक्सक्यूज मी, बट दैट डिस्ट्रैक्ट्स मी. प्लीज डोंट टॉक इन बिटवीन. जेंटलमैन, this is very important. Even if you read 10 books, you will not get this. Little curvature of the penis is a normal phenomena. There is nobody on the earth who has got penis at 90 degree angle. थोड़ा लेफ्ट पर आके राइट पर जाएगा तो सीधा, थोड़ा ऊपर होके नीचे जाएगा तो सीधा. अरे दरवाजे के अंदर से बाहर जाना है, जरूरी चीज क्या है? दरवाजे में से बाहर जाना. सर ऊपर रख के जाओ कि नीचे रख के क्या फर्क पड़ता है? हाँ, एक्सट्रीम कर्वेचर रही, अंदर डालने में दर्द हो रहा है, then you have to look for it. संभोग कितना करते हो वो जरूरी नहीं है, कैसे करते हो जरूरी है. कितनी भी बार करो कोई फर्क नहीं, दोनों को संतोष होना चाहिए. तो ये सेशन के अंदर आप ये चीजें कवर करेंगे. साइकोलॉजिकल, ऑर्गेनिक, मिस मास्टरबेशन, कर्वेचर, फ्रीक्वेंसी. अगर एक आदमी ने सुन्नत करवाई है मियाँ, वो ज्यादा लंबा चला सके वो गलतफहमी है, वैसा नहीं होता है. और वीनस लीक रेयर होता है. आदमी को डिजायर हुआ, थोड़ा एक सेकंड हुआ और आज बैठ जाएगा. दैट इज द हिस्ट्री. दैट्स अ रेयर कंडीशन. ये आदमी की पेशाब की जगह है, सोई हुई अवस्था में ये ज्यादा खून गया तभी खड़ा होती है. हर चीज खून के ऊपर है. अरे भाई, 2 ट्यूब है, एक में से पानी जा रहा है, दूसरे में से मध. जल्दी कौन सा जाएगा? पानी. क्यों? पानी पतला है. उसका मतलब खून गाढ़ा हो गया कि नली छोटी हो गई तो इंद्रिय उठने में तकलीफ हो सकेगी. सीधी बात है. उसकी वजह क्या है? तंबाकू, डायबिटीज, खून की चर्बी, ब्लड प्रेशर. आप मोटिवेट कर सकते हो कि भाई तंबाकू छोड़ दो, बंद मत करो. डायबिटीज हो तो कंट्रोल में रखो, ब्लड प्रेशर हो तो कंट्रोल में रखो. आप उसको इन्वेस्टिगेशन के लिए भेज सकते हो. बाद में थोड़ा एम्फेसाइज भी कर देना ज्यादा. देखो भाई, इसके अंदर कोई मसल्स है ही नहीं, कमजोरी आने का सवाल नहीं है, कोई हड्डी है नहीं, फ्रैक्चर हो नहीं सकता है. अरे आप कॉन्फिडेंस से बोलोगे तो सामने वाले में कॉन्फिडेंस आएगा. आप भी ही यू करोगे तो क्या बोले? कुछ नहीं होगा. यू हैव टू बी कॉन्फिडेंट, एंड दैट यू कैन डू इट ओनली इफ एट ऑल योर फंडामेंटल्स आर क्लियर. हाँ, यहाँ पर तुम वो भी कर सकते हो कि मुझे तुम्हारा, ऐसे ही कोई आदमी को तुम बोलेगा मैं तेरा ब्लड प्रेशर चेक कर रहा हूँ, आप उसको एक्सप्लेन करो कि भाई देखो पेनिस का ब्लड प्रेशर लेंगे, हाथ का ब्लड प्रेशर लेंगे. जरा मैं सीधा बताऊंगा, मैं जिंदा हूँ कि मर गया कैसे मालूम पड़ेगा? पल्स देखेंगे तो यहाँ पर, अरे भाई इसकी पल्स यहाँ होती है, पल्स आप देखेंगे. साथ में पीनाइल ब्लड प्रेशर ले लिया, ब्लड प्रेशर का रिजल्ट ले लिया. दूसरे दिन आपको मालूम पड़ा, आपका काम भी हो गया, कंसल्टेशन भी हो गया, पेशेंट भी खुश हो गया. एग्जामिन किए बगैर कोई पेशेंट को छोड़ने का नहीं, वो बहुत जरूरी चीज है. माने एथेरोस्क्लेरोसिस मालूम पड़ेगा, पीबीआई मालूम पड़ेगा, प्लेक है कि नहीं आप देख सकोगे. अगर आपको प्लेक तो आप मालूम पड़ेगा. और मसल्स है नहीं, कमजोरी आने का सवाल नहीं. स्ट्राइटेड मसल्स कोई नहीं है, हड्डी है नहीं, फ्रैक्चर हो नहीं सकता. ये आदमी के पेशाब की जगह है. ये 2 अंडकोश है, ये प्रोस्टेट की ग्रंथि है, ये पेशाब की थैली है. यहाँ पर 2 तरीके के सेल्स हैं. एक में से हार्मोन बनते हैं. क्या बनते हैं? हार्मोन, जिसकी वजह से आदमी को दाढ़ी आती है, मूछ आती है, बगल में बाल आते हैं, पेशाब की जगह पर बाल आते हैं, काम करने का दिल होता है और वीर्य का थोड़ा बहुत वॉल्यूम बनता है. दूसरी चीज शुक्र जंतु बनाती है. क्या बनाती है? शुक्र जंतु. 1 मिनट में 50,000 बनते हैं, और एक आदमी काम करता है तो 120 करोड़ निकलते हैं. बच्चा पैदा करने के लिए कितने चाहिए? सबके सब पैदा करते तो एक रात में पूरा हिंदुस्तान खड़ा हो जाए. थोड़ा हंसी भी जरूरी है, सीरियस होने का कोई मकसद नहीं है इतना. हाँ देखो, पेट कर अभी पेट पकड़ के हंसता है. खरा है कि खोटा है? और दूसरी चीज शुक्र जंतु में जो पानी निकलता है ये 24 घंटे बनता रहता है, उसमें 99.9% की चिकनाहट सेमिनल वेसिकल्स और प्रोस्टेट में से आती है। शुक्र जंतु 24 घंटा यहां से बनता है, 1% से भी कम होता है। ये 24 घंटा बनता है, आपने निकालोगे तो अपने आप निकल जाएगा। एक पानी का गिलास है और पानी भरोगे तो क्या होगा? अरे क्या होगा? बह जाएगा, छलक जाएगा, ओवरफ्लो हो जाएगा। आप संभोग नहीं करोगे, मैथुन नहीं करोगे, हस्त मैथुन नहीं करोगे तो रात को स्वप्न मैथुन में निकल जाएगा। आप पेशाब नहीं रोक सकते हो, संडास नहीं रोक सकते हो, इसको कौन रोक सकेगा? बात खत्म हो गई, स्लीप एमिशन का प्रॉब्लम निकल गया। लेकिन डॉक्टर साहब फिर ब्रह्मचारिज्म का क्या? अरे ब्रह्मचारिज्म का मतलब वीर्य को पकड़ रखना नहीं है, वो मुमकिन नहीं है। दुनिया में कोई आदमी पकड़ नहीं रखता है, ये 24 घंटा बनता रहता है। आपने नहीं, पेशाब नहीं रोक सकते, संडास नहीं रोक सकते, पसीना को, ये इसको कौन रोक सकता है? सवाल ही पैदा नहीं होते। ब्रह्मचर्य का असली मतलब है, ब्रह्म माने आत्मा, क्रिएटर ऑफ यूनिवर्स, और चर्य माने शोध, इन सर्च ऑफ। आत्मा की शोध, उसका ब्रह्मचर्य, उसका मतलब है ब्रह्मचर्य। वीर्य को पकड़ रखना वो नहीं है। Am I clear? हार्मोनल अगर कम रहा आपको मालूम पड़ जाएगा। मिथ सीमेन को आपने क्लियर किया। एक ब्रह्मचर्य मीन्स, ब्रह्मा मीन्स क्रिएटर ऑफ यूनिवर्स, एंड चर्य मीन्स इन सर्च ऑफ। इन सर्च ऑफ क्रिएटर ऑफ ब्रह्मा is known as Brahmacharya. That's the real Sanskrit meaning of Brahmacharya, not the holdings of semen. Clear? Second, kabhi bhi never ask a semen examination in a case of erectile dysfunction, because sterility and virility are two entirely different things, depend upon the different types of cells present in the testes. Absence or presence of sperms has nothing to do with the sexuality of an individual. Please remember that. Second, sleep emission we have discussed, brahmacharya we have discussed. Sleep emission. Sorry. डॉक्टर साहब मुझे दांत जाता है। नॉर्थ में ये बड़ा कॉमन है। कैसे दांत जाता है? जब खास करके मैं टॉयलेट में बैठता हूँ, जरा जोर करता हूँ और थोड़ा प्रेशर लगाता हूँ तो एक दो चिकनाहट का गिर जाता है। क्या करूं? वजन कम हो जाता है, डिप्रेशन में चला जाता है आदमी, एंजाइटी की वजह 10-10, 12-12 पाउंड वजन हो जाता है, कम हो जाता है। ये क्या होता है पहले आप जान लो। ये वीर्य जब भी निकलता है तभी पेशाब का दरवाजा बंद हो जाता है। ये दरवाजा बंद हो जाता है तो वीर्य और यूरिन कभी भी मिक्स हो नहीं सकता, कभी भी हो नहीं सकता मिक्स। जो आप देखते हो वो यहाँ का खर है और ये प्रोस्टेट का खर है। 10 बूंद पसीने के रहा और 11वां मिलते ही नीचे गिर जाता है। यही माहौल यहाँ होता है। लोग यहाँ फिक्र नहीं करते, यहाँ फिक्र करते हैं क्योंकि पैदा हुए तब से कान पे हाथ लगाए, नाक पे हाथ लगाए, मुंह पे हाथ लगाए, कोई कुछ नहीं कहेगा। पेशाब की जगह पर हाथ लगाए, अरे ऐसा गंदा करते हो। तभी से हमारे दिमाग में ये ख्यालात डाले गए हैं कि ये कोई खास चीज है और उसमें से निकलती हुई हर एक चीज खास है। हकीकत में जैसा हाथ है, पांव है, मुंह है, ऐसी ये चीज है। हाँ जी, please tell me. You see, what I am telling you is that this is because of there are about 10 drops of perspiration. When the 11th one meet, it falls down. Same thing happens here. When you sit on the toilet seat and do a little pressure, the pressure is exerted on this side. Small droplets of the urethral fluid and the prostate mix together and a drop or two falls down. If at all there are 10 drops of perspiration here and the 11th one meet, it falls down. Same thing happens here. People worry here, they don't worry here. Because right from the childhood, if we touch at the nose, mouth here, no one worries. The moment we touch at the private part, everyone says, sir, it's dirty. Means right from those days, these ideas have been implanted in your mind that this is something special and anything coming out of it is special. There's nothing so special about it. And this particular problem in our country is because of our toilet habits, sir. Here we discuss about the Cowper's gland fluid. Sometimes patient will have desire, get erection, a drop or two will come out. This is Cowper's gland fluid. Cowper's gland fluid oozes out. Semen squirts out. Carpus gland fluid is transparent. Semen is white. Cowper gland fluid is 2 or 3 drops. Semen is 2 to 3 ml. Clear? Remember, I have seen plenty of people stop doing intercourse because they feel कि धात आ गया. Remember, Tariq, even in case of नमाज के लिए भी ये कच्चा धात माना जाए. आदमी को नापाक नहीं होता, वुजू करने की भी जरूरत नहीं. So this is a normal thing. This is not ये कच्चा धात है. This for there are some religions who prohibit, in Jains as well as in Mohammedans basically. This is because of the toilet habit. When during my stay abroad, not a single patient. यहाँ every third patient in KM धात जा रहा है, डॉक्टर साहब धात जा रहा है. So this problem is present only in Hindustan, Pakistan, Balochistan, Afghanistan, Turkestan. Why? Our toilet habit. यहाँ पर लोग देखते हैं, टॉयलेट में जाते हैं तो सीधा देखते हैं. यहाँ पर उकड़ू मार के बैठते हैं और एडवर्टाइजमेंट बड़ी होती है कि पेशाब रख के रास्ते से पोषक द्रव्य जाता हो तो हमको आके मिलो. जो देखा वो फंस गया, जो नहीं देखा वो बच गया. I must tell you, I have done original research in Kama Sutra. I mean, Vatsayana. I've done original research in orgasm. But if you ask me, which is the best research which has helped my countrymen, it is this research. This is that is because of what? If you explain to the client, थोड़े टाइम के बाद उसको अच्छा लगेगा. अगर symptoms हो उसको anxiety का, you are justified. Palpitation, और कुछ तकलीफें हैं, ऐसे कुछ मुंह पसीना आ जाता है, बहुत सीवियर एंजाइटी है, you can advise an anti-anxiety drug. Before advising anti-anxiety drug, see that you rule out there is no thyroid problem or there is no mitral valve prolapse. This both can give rise to, you know it better, can give rise to symptoms suggestive of panic attack. I have to respect the cardiologist sitting here, that's why. Am I clear, please? धात सिंड्रोम के लिए दवाई लिखने का कोई जरूरत नहीं है. ये लड़की है जिसने संभोग नहीं किया, पर्दा है. ये लड़की ने संभोग किया है, पर्दा नहीं है. इसने संभोग नहीं किया फिर भी पर्दा नहीं है. पहली रात को खून निकलना चाहिए, वो जरूरी नहीं है. हाइमेन होता है, बचपन से कई बार एब्सेंट भी होता है, टूटा हुआ होता है, थोड़ा स्ट्रेच भी कर दिया, टेम्पोन यूज करने में, मास्टरबेशन करने में या एक्सरसाइज करने में भी फट सकता है. मैंने बहुत सी शादियां इसकी वजह से टूटते हुए देखा है. ये लड़की सीधी खड़ी है, आड़ी काट के दिखाइए. ये बाहर का भाग है, क्लिटोरिस है, पेशाब की जगह है, संभोग की जगह है, पेशाब की जगह है, यूरेथ्रा, संभोग की जगह है, संडास की जगह. एक्सप्लेन टू देम कि पेशाब की जगह के अंदर उंगली भी नहीं डाल सकती है, इंद्रिय जाने का सवाल ही पैदा नहीं होता. संडास की जगह बिल्कुल नीचे है, एक ही जगह जाएगा, वो यहाँ पर. योनि मार्ग की कुल लंबाई कितनी होती है? 6 इंच. आगे के 1/3 हिस्से में ही सेंसेशन रहते हैं, अंदर का 4 इंच बिल्कुल सुन्न है. जलती हुई सिगरेट डाल दो, लड़की को महसूस में नहीं होगा, डालना मत. हाँ, मैक्सिमम सेंसेशंस बाहर होते हैं और आगे के 1/3 में 2 इंच में होते हैं. अंदर बेकार है. उसका मतलब ये हुआ कि अगर आपको पार्टनर को एक्साइट करना हो तो you are all busy person, don't waste time inside, concentrate only in outside and outer 1/3. Second, what could be the size of the penis? It could be anything from 2 inches or more. Longer the better is a Godzilla logic. You see? Remember, it's not the length of the wave that matters. It's the motion of the ocean that is important. ठीक है, कितना लंबा है वो जरूरी नहीं है, कैसे करते हो वो जरूरी है. आपको ये 3 चीज, फीमेल सेक्सुअल एनाटॉमी, एरिया ऑफ अराउजल, और ये 3 चीज आपको एक्सप्लेन करनी है. ये लड़की है, विचार से, ख्याल से, टेस्ट से, हाथ लगाने से I mean, sorry, either by the sight, order, fantasy of train or thought or touch, there is a sex center in the brain. When it is aroused, the messages are relayed down. When the messages are sufficient, the further messages go down, there is flow of blood and a woman gets wet. This lubrication is 10% psychological in nature. If the woman is not interested in the sex act, she may not lubricate. And she is aroused further. She reaches what is known as orgasm. क्या होता है जब लड़की orgasm पर पहुंचती है? The most experienced person, Dr. Nath. What happens when a woman reaches orgasm? अरे she gets satisfaction तो even एक साड़ी लाके दिया तो भी satisfaction मिल जाता है. She gets lubricant. अरे मेरे बाप, lubrication is not orgasm. पेट कर. Not necessary. भाई वो बात बराबर है, pupils dilate, लेकिन ये सब देखने को जाओगे तो there will be more work and less pleasure. अपन कहाँ माइक्रोस्कोप लेके देखेंगे मुझे आएगा प्यूपिल्स बड़ा हुआ, हार्ट रेट बड़ा हुआ, ये कार्डियोलॉजिस्ट को करने दो यार. अरे भाई गुजराती छोकरी आवे तो पूछવું પડે તને સંતોષ મળ્યો, મરાઠી આલી તો ભલા વિચારેલા પડતા તોલા સમાધાન भेटला का. पंजाबी they use the word तसल्ली, तमिल they use the word तृप्ति, तेलुगु they use the word संतृप्ति, कश्मीरी they use the word खुशी. एक लड़की झोपड़पट्टी में आई थी, बोले डॉक्टर साहब मेरे शौहर जल्दी खत्म हो जाते हैं और हम नशे में नहीं आते हैं. So an orgasm is an orgasm is an orgasm. If a woman has reached one, she knows about it. Otherwise, any attempt to explain it is like explaining a rainbow to a blind man. एक सवाल पूछ लो. Did you get the feeling of enough and nothing more? बस अब नहीं. ये feeling आई कि नहीं? वो बोली हाँ, she has reached climax. If not, you have to work further. Vaginal contractions are not necessary in all women. Orgasm lies between the 2 ears and not between the 2 legs. Please remember that. Lubrication is not orgasm. Patkar. Khayal rakhna. Am I clear, please? Vaginismus, what happens? A woman gets aroused. She's about to burn because of fear. दोस्तों ने बताया होता है कि पहली रात को इतना खून निकलेगा, दर्द होगा. She brings her legs together. There is involuntary spasms in the outer 1/3 of vagina, and the entry of penis becomes impossible because she brings her legs together. This is known as vaginismus. You need to control involuntary spasms into voluntary. That is the crux of the treatment. And by supportive psychotherapy and behavior modification, usually you can click this problem within a week's time max. Lubrication is 10% psychological in nature. If the woman is not interested in the sex, she may not lubricate. Other causes could be endocrine imbalance, estrogen deficiency, or vaginal infection could be there. Barring this, by and large, this particular thing is psychological. मेरे यहाँ एक बहुत बड़े शायर आए थे पाकिस्तान से, जगजीत लेके आए थे. तो क्या प्रॉब्लम है? उनको पता ही नहीं था कि पार्टनर को सेटिस्फेक्शन करने का है, होता है. तो क्या तकलीफ है? तो डॉक्टर साहब मुझे तो कोई तकलीफ नहीं लगती, आप मैम साहब को पूछिएगा. दिस वाज हिज गर्लफ्रेंड, 1/3 ऑफ हिज एज. तो क्या तकलीफ है? मतलब डॉक्टर साहब मैं बता नहीं सकती हूँ, मुझे जरा शर्म आती है. बताएंगे तो मैं इलाज कैसे करूंगा? डॉक्टर साहब मुझे शर्म आती है, मैं इलाज करना मेरे लिए मुमकिन नहीं है. अच्छा मैं बताती हूँ. वो भी शायरा थी. उसे बोलते डॉक्टर साहब बात कुछ ऐसी है, 2 लाइन उसने बताई, मैं समझ गया प्रॉब्लम क्या था. बात कुछ ऐसी है कि वो तो नहा के चल दिए और लहरें तड़पती रह गई. So remember one thing, even if you are unable to explain to her how to go about, there are one way or the other you can take her to climax, which is not difficult. Either oral sex, masturbation by one way. What is important is satisfaction, because sexual pleasure is not a performance to be gauged. It's a pleasure, or more correctly, happiness to be shared between 2 individuals. Lubrication and foreplay, myths about menopause. A woman can continue. Remember, problem of menopause occurs usually after 4 or 5 years after the menopause. 50 साल में पीरियड गया तो 55 को आएगा, उसी वक्त नहीं आएगा. And you can give her a diet which is rich in estrogen, sir, which contains soya and methi. These are proved. Testosterone is equally important for the female. Her sensitivity of the gland, her nipples and clitoris is based solely on testosterone. But you can't give testosterone. So you give a diet which is rich in testosterone. उड़द की दाल, हिंग और लहसुन का तड़का लगा के हफ्ते में 2 दिन खाने को दो। और आप जैसे आदमी अगर एस्ट्रोलॉजी में बिलीव करते हैं तो उसको मैं बोलूंगा शनि और मंगल के दिन दो, अनुमान के दिन है। अगर एस्ट्रोलॉजी में नहीं बिलीव करते तो बात और है, लेकिन अगर मैंने देखा कि जुपिटर है तो मैं वही एडवाइस करूंगा। आई वांट माय क्लाइंट टू बी सेटिस्फाइड, पीरियड। ये आदमी विचार से, ख्याल से, टेस्ट से, हाथ लगाने से दिमाग में सेक्स का सेंटर है। उत्तेजित हो तो मैसेजेस नीचे आएंगे, बराबर आएंगे तो ही आगे जाएगा, खून का बहाव होगा और इंद्रिय में ताकत आएगी। मैसेजेस कम आया है ताकत नहीं आएगी, जरूरत से ज्यादा आया तो पानी जल्दी छूट जाए, पानी जल्दी छूट जाएगा। बड़ा अच्छा शेर एक शायर ने आके बताया था। मैं तो मियाँ क्या तकलीफ है, ऐसे ही मियाँ भाई जरा आशिक की माहौल को तो आदमी रहते ही है, तारिक मियाँ है ना। डॉक्टर साहब बात ऐसी है, कुछ ऐसा वक्त मुझ पर आ गया है, शेर सुनना, प्रीमेच्योर इजैकुलेशन, अर्ली ऑर्गेज्म पर है। कुछ ऐसा वक्त आराम से लिखिएगा, कुछ ऐसा वक्त मुझ पर आ गया है, कुछ ऐसा वक्त मुझ पर आ गया है, अरे सफर बाकी है और घर आ गया है। कुछ ऐसा वक्त मुझ पर आ गया है कि सफर बाकी है और घर आ गया है। ऐसे शेर हर एक चीज पे है। फोरप्ले में सुनाओ, फोरप्ले कि नजरों से मेरी वो बचा ले कैसे, नजरों से मेरी वो बचा ले कैसे, खुलते हुए सीने को छुपा ले कैसे, अरे आटे से सने हैं दोनों ही तो हाथ, आंचल जो संभाले तो संभाले कैसे। Same person writes on intercourse. रुख माने फेस, लब माने होठ, रुखों के चांद लबों के गुलाब मांगे हैं, रुखों के चांद लबों के गुलाब मांगे हैं, बदन की प्यास बदन की शराब मांगे हैं। जानिसार अख्तर लिखते हैं ऑर्गेज्म पर कि अशार मेरे यूं तो जमाने के लिए हैं, अशार मीन्स कलेक्शन ऑफ शेर्स, अशार मेरे यूं तो जमाने के लिए हैं, कुछ शेर मगर तुझको सुनाने के लिए है। अशार मेरे यूं तो जमाने के लिए हैं, कुछ शेर मगर तुझको सुनाने के लिए है। सोचो तो बड़ी चीज है तहजीब बदन की, सोचो तो बड़ी चीज है, तहजीब माने मैनर्स, सोचो तो बड़ी चीज है तहजीब बदन की, वरना तो बदन आग बुझाने के लिए है। फिर से सुनाओ, और एक शेर सुनाओ, इसी का रह गया है। अशार मेरे यूं तो जमाने के लिए हैं, कुछ शेर मगर तुझको सुनाने के लिए हैं। देखूं जो तेरे हाथ तो लगते हैं तेरे हाथ, मंदिर में फकत दीप जलाने के लिए हैं। और सोचो तो बड़ी चीज है तहजीब बदन की, वरना तो बदन आग बुझाने के लिए है। ये था ऑर्गेज्म पर। आफ्टर प्ले इज इक्वली इंपॉर्टेंट। अगर आपने लड़की के साथ आफ्टर प्ले किया तो ये समझ लेना वो लड़की जानती है कि तुम उसको मोहब्बत करते हो। बिकॉज फोरप्ले एंड प्ले, foreplay and play, I'm sorry, foreplay and play you can do without love, after play you can't do without love, after play you can't do without love। कि तुझको गए हुए तो बहुत देर हो चुकी, तुझको गए हुए तो बहुत देर हो चुकी, अब तक तुझे गले से लगाए हुए हैं हम। कमिंग बैक, femoral pulsations आप देख सकते हो, डायबिटीज यू कैन एक्सप्लेन, orgasm problems, early orgasm, delayed orgasm, impaired orgasm, absent orgasm. Retrograde ejaculation, patient will say, doctor, I have desire, I get erection, I ejaculate, but nothing comes out. It's a dry run. As a man grows older, he walks slow, he talks slow, but he expects that the erection should not be slow. Why? He watches it. Hota hai ki nahi, hota hai ki nahi, hota hai ki nahi, hota hai ki nahi. Are you breathing now? Are you breathing now? आप सांस ले रहे हो? पहले एहसास नहीं था, अभी एहसास हो गया. तो इतने जितना ध्यान दोगे होता है कि होता नहीं होगा, और जितना बेफिक्र हो जाओगे होने लगेगा. Because you can't be anxious and sensuous at the same time. It's difficult. Sex tonics की बात कर रहे थे. There are three ways by which the sex tonics works. Either it alters the mental state. Common example is alcohol, cocaine, charas, ganja, bhang. Second, yohimbine. It's a sort of a bark of a tree which increases the flow of blood in the entire body, including the private part. But it's not selective, it's all over. Third is Spanish fly. Spanish fly is a variety of an insect known as Cantharis vesicatoria. It's dried and heated until it disintegrates into a form of a fine powder. It's taken with a drink which passes unchanged to the urine and leads to reflex erection. The margin between the therapeutic dose and lethal dose is very, very narrow. So by and large, all these sex tonics which are sold on the counter cannot work. Why? Because they basically violate the basic Ayurvedic principles. If you pluck a plant today, the effect wears off within 6 months of time. तो कोई भी दवाई की दुकान देख लो आप, कोई भी दवाई, उसके ऊपर प्लांट कभी तोड़ा है वो तो लिखा ही नहीं, मैन्युफैक्चरिंग डेट लिखी है, वो भी जब भी बनाई और काउंटर पे आएगी 1 साल निकल जाएगा. कैसे काम कर सकती है? दूसरा, they say that at least your body needs to be pure, because you can't paint on a dirty cloth. Similarly, medicines will not be effective if at all your body is impure. So it needs to be pure. So they advise panchakarma for vajikaran. यहाँ पर कोई एक पर्ज भी एडवाइज नहीं करता है. ऐसे 5-6 reasons है. That's why whenever a tablet is given, it's a picture of a horse or bull that works, not the tablet. If an injection is given, by and large, it's a prick of the needle that works and not the contents of the syringe. Sir, for sex tonics, is nothing but exploitation of the desperate by the ignorant. Herbal sex tonics. Ayurveda is a fantastic science, but it needs to be used properly. A human understanding, empathy, and offering of the adequate sex knowledge are the most powerful remedies, and the value of which tends to be neglected in this modern age. In my opinion, their increased application could obviate the majority of the use of tranquilizers and so-called sex tonics. Thank you very much for the patience. तालियां बजाई नहीं आपने. एक शेर बोल दूं, आप मुझे कहो उस पर बोल दो. You give me the topic, I'll recite on that. Sorry? मेरा पसंद है सर, तू अगर सैर को निकले तो उजाला हो जाए. जोश मरियाबादी is describing his beloved. तू अगर सैर को निकले तो उजाला हो जाए, माथे पे डाले हुए सुरमई शाल का शीरा, बाल खोले हुए लगाए संदल का टीका, यूं जो हंसती हुई तो सुबह को आ जाए जरा, बागे कश्मीर के फूलों को अचंभा हो जाए, तू अगर सैर को निकले तो उजाला हो जाए. कि सुबह के रंग ने बख्शा है ये मुखड़ा तुझको, शाम की आंच ने सौंपा है ये जूड़ा तुझको, कभी पास से देखा है जो हिमालय तुझको, इस तेरे कद की कसम और भी ऊंचा हो जाए, तो अगर सैर को निकले तो उजाला हो जाए. अब I would say for example, if a patient has anxiety, I would prescribe anti-anxiety if there are symptoms available. Suppose if there is anxious patient, he has got palpitation, he has got perspiration, is worried, anxious. In such situation, you are justified in prescribing short-acting anti-anxiety drug like clonazepam or clonazepam. I would prefer clonazepam, that 2.25 milligram. The action starts within about 15 minutes or so and remains for about 12 hours. So I would advise them to take SOS. Their mouth dissolve also available. My choice would be clonazepam, would be the reasonably suitable drug. But if at all it is pan-anxiety, there are some big features of pan-anxiety, then I would prescribe something like aripiprazole, because that can take care of severe anxiety, and my understanding is not very great about as good as psychiatrists. So I would play safe. But if I find that there are major psychotic changes and I need to have antipsychotic medication, I would refer them to a competent psychiatrist and stay with the client till the problem is solved. At the same time, certain things I was also advised. भाई पुराने जमाने में 100 साल पहले ये दवाइयां नहीं थी. What were you advising? Old cow's ghee and long walks. कोई नुकसान भी नहीं है. आयुर्वेद ऐसा बताता है कि ये दो चीज आपको फायदेमंद हो सकती है. वो लोग उसको उन्माद बोलते थे. So we take only things which are good, not which are having side effects. Yeah? PDE5? Why Gokshura? No, why Gokshura? Gokshura I will advise only if at all there is a problem. Gokshura is basically a diuretic. Gokshur. In Ayurveda, it is also known as Gokru. It's a diuretic. It's also a rasayan. Rasayan means retains the youth and delays the process of growing old. But Gokshur, if there is a urinary problem, theek hai, not otherwise. For erection, if at all, I would see that if at all I can help the patient without the medication, I will try to do that, because whatever is sensual could be sexual. Whatever is sexual need not be sensual. So I would arouse the feelings from his own body, because there are plenty of erogenous zones in the body. So I would do that. If I fail in that, I would add PDE5. If at all I have to add PDE5, I will not prescribe tablet. I will prescribe a strip, film. You keep it on the tongue, absorbs within 1 minute, and you are charged within 10 minutes. And it is safer comparatively because it bypasses liver, absorbs straight from, so it bypasses the first phase. So I would prefer a film instead of tablet, giving proper safety to the client. SOS, if at all it is sildenafil, I ask him to take it before, action will be 4 hours. If it's an elderly individual, I would go with sildenafil and not tadalafil, because tadalafil would be action lasts for a longer time. So kabhi heart ka problem hua, so we can't give nitrates to him. So looking at that, I would advise. I am not against any medication, but I will use it rationally. Plan of action with low testosterone? Plan of action with low testosterone. Best would be to give something like urad ki dal twice in a week. Say 2 katoris of black urad dal. 2 katoris of black urad dal. Hing or lasan ka tadka deke, so that the vayu element reduces. Preferred at lunchtime, so gaseous feeling nahi hoga. That would take care of your testosterone level. I found it quite useful. In addition, you can give fenugreek methi, 1 teaspoonful, to be swallowed at bedtime, not chewed or not soaked. Usually it gives enough of testosterone. If I fail in that for about first 3-4 2-3 mahine mein results nahi aaya, then I would use a testosterone undeconate. उसमें भी the oral tablets are available, injectable is available, as well as gel is available. Oral I would not advise because absorption नहीं होता है बराबर. You require a rich fatty medium. इंजेक्टेबल आज दिया, फिर 6 हफ्ते के बाद और फिर 6 महीने के बाद, उसमें रोलर कोस्टर इफेक्ट मुझे लगा. बट जेल आई फाउंड इट क्वाइट यूजफुल. लोकल एप्लीकेशन, you can stop whenever you want. There is no roller coaster effect. Only thing it turns out to be expensive. Before giving testosterone, I will always check PSA if the person is 45 plus, so that I would avoid, if at all there is any risk of, because testosterone can precipitate occult or microscopic cancer of the prostate gland. That is why. Sir, I hope you have answered your question. About the
Ayurveda, Gita and whatnot, it is written as a precious fluid and it has to be preserved. It is such a deep-rooted thing.
नहीं सर,
How to overcome this?
नहीं सर, आयुर्वेद में दो थिंग है. One is genuine Ayurveda and second is yellow literature of अमृतसर. ये सब येलो लिटरेचर ऑफ अमृतसर में लिखा है. पकड़ के रखो, 1 बूंद सीमेन बराबर 100 बूंद खून. आयुर्वेद चरक संहिता, सुश्रुत संहिता, अष्टांग हृदय और कामसूत्र में कहीं भी ऐसा नहीं लिखा है कि वीर्य पकड़ के रखो. कहीं भी ऐसा नहीं लिखा है कि हस्त मैथुन खराब है. हम लोगों ने क्या है, हम लोग मस्तराम की किताब पढ़ते थे, आज भी पढ़ते हैं कभी कभी बाय चांस ऐसा. तो वो उसमें सब ये रहता है तो सारा वो सब कंफ्यूज हो जाता है. बाकी शास्त्र में नहीं लिखा है. पढ़ना कोई बुरी बात नहीं है, लेकिन इट गिव्स, it arouses you, but to that extent it's good. But ये जो लिखा है वो गलत लिखा है.
Proponent of Ayurveda, you have really truly gone into depth. But many of us from allopathy, we have no knowledge.
Sir,
At the same time, you say that many of these drugs which are sold are just fake.
No.
No,
No,
I mean these tonics.
Sir, only
sex
tonic.
tonics.
The reason is,
Yeah.
if you pluck a plant today, if you use it in a fresh manner, it would be very effective. उड़द का दाल कोई सवाल नहीं आता है सर, आपको अच्छा है. मेथी दाना कोई सवाल नहीं आता है. मैं कच्ची मेथी खाने को नहीं बोलता हूँ. सॉलिड. और ये सब प्रूव्ड है. अभी सेक्स टॉनिक काम नहीं करता है तो नहीं करता है, because it violates the basic principles, and unless and until you know the physiology and pathology of an individual, prakruti and vikruti of individual, Charak mentioned you should not prescribe any sex tonics because it could be as dangerous like thunder or serpent bite. नहीं है तो नहीं है. अच्छा, जो अच्छा है वो अपने को लेने का है. आयुर्वेद is the only science which advises अन्न ही औषधम. Food is medicine. ये एक ही ब्रांच है ऐसा जो बताती है. एलोपैथ एंड होम्योपैथ डोंट. इट्स ओनली आयुर्वेदा. तो अपन उसको यूज, भाई खाना कभी खाना चाहिए, कब खाना चाहिए, भूख लगे तब. पानी खाने के साथ कब पीना चाहिए, जब भी आप खाना खाते हो थोड़ा. खाना के बाद के पहले और बाद में नहीं खाना चाहिए, अदरवाइज इट विल डाइल्यूट द जूसेस. और आप चबा के खाओ. बड़ा अच्छा लिखा है चरक ने. क्यों चबा के खाओ? पेट को दांत नहीं होते. एक बार बता दिया पेट को दांत नहीं होते, आप दूसरे दिन से चबा के खाने के लगोगे. ये सब चीजें आयुर्वेद में लिखी है. अच्छी, जो अच्छी चीजें है वो अपना ले. बुरा, अच्छा लगे तो अपना लो, बुरा लगे तो जाने दो. ना मोहब्बत की नहीं जाती, मोहब्बत हो ही जाती है. मोहब्बत की नहीं जाती, मोहब्बत हो ही जाती है. ये शोला खुद भड़कता है, भड़काया नहीं जाता. और मोहब्बत करने के लिए कुछ खास दिल मखसूस होते हैं. ये वो नगमा है जो हर सांस पर गाया नहीं जाता.
Very good.
Sorry. I've been.
Actually, my question is regarding the age factor. So actually, I'm very junior on this platform, but जो देखा है मैंने कि age factor regarding the female means at the what age female can do the sex means हम वाजीकरण therapy advise करते हैं till the age of 70 male के लिए. What about the female means actually at the age of
for
40,
male and female, Vatsyayana mentions he opens his treatise with mentioning saptati yauvanam. Up to 70, there is youth. A woman or a man can enjoy till the last breath of her life if she desires or if he desires. फर्क थोड़ा जरूर पड़ता है. यहां से सामने तक दौड़ के जो स्पीड से मैं आज पहले जाता था, आज नहीं जा सकता हूं, लेकिन चल के जरूर जा सकता हूं मरने के आखिरी दम तक. So the potency can be preserved, no problem at all. If at all, lies essentially between the 2 ears and not between the 2 legs. And the best sex partner is an interesting and interested partner asking to be enjoyed.
After sildenafil, vardenafil, what is the next?
देखो डॉक्टर, मेरे पास तो है यार. नहीं, डोंट मूव दैट, यू नो. उसके हाथ में से ले लो. हाथ में दिया है तो ही इज जस्ट मूविंग टू एंड फ्रो. व्हाई कमाल करते हो.
आप ये कहना चाहते हैं आदत से मजबूर है ये?
नहीं, ठीक है, आई अंडरस्टैंड, बट लेकिन क्या बात कर रहे थे हम? आगे कुछ ना कुछ निकलेगा तो अपन ये देखो, ये फायदेमंद चीजें हैं. बहुत सी शादियां आप बचा सकते हो. द मोस्ट कॉमन कॉज फॉर डिवोर्स इज सेक्सुअल इनकम्पैटिबिलिटी. तो यहाँ डिजायर और इरेक्शन सस्टेन करता है, क्वालिटी ऑफ इरेक्शन बढ़ाता है, तो आदमी संभोग बराबर कर सक. कितना भी योगा करो ये काम नहीं आएगा. पेट कर सब आदमी सो जाएगा, आखिर में ये काम करेगा. पूछो, तुम्हारे बाजू में ही है सब एनसाइक्लोपीडिया सेक्सुअल. हाँ जी,
माइक यूज करो अमित.
There was one case report from Denmark where an 100-year-old female reported to experience orgasm even at the age of 100. So, age, as sir rightly said, age is not a bar for even women.
नहीं, मैंने अगर कोई करना चाहे तो कर सकता है. करना चाहे तो कर सकता है. The capacity remains, but as you walk slow, you talk slow, you get aroused also little slow. और दोनों पार्टनर साथ में हो. और अगर इसमें क्या है, sex can be the climax of love, but love need not be the climax of sex. मोहब्बत की आखिरी मंजिल हम बिस्तरी हो सकती है. ओ तारिक मियां, मोहब्बत की, हाँ दोनों तारीख, मोहब्बत की आखिरी मंजिल हम बिस्तरी हो सकती है, लेकिन हम बिस्तरी की आखिरी मंजिल मोहब्बत हो वो जरूरी नहीं है. और दूसरा, देयर इज अ डिफरेंस बिटवीन मैन्स लव एंड वुमेन्स लव. By and large, somebody has said a man gives love to get sex and a woman gives sex to get love. I and you can speak this confidently because our partners are not around.
And also, Petkar sir, there is a common dictum, use it or lose it. If you keep the function of an organ in an intact condition, it will remain functional till very advanced stage. But if you have stopped using it, obviously the tool will not work. Any more questions?
सर मुझे
आपका नाम तो बताओ पहले लोगों को.
मैं डॉक्टर रमेश माहेश्वरी पुणे से हूँ. सर मेरा एक प्रश्न यह है कि अभी बहुत से प्रॉब्लम गे और लेस्बियन इज इक्वल इन बोथ. यदि 80% हेट्रोसेक्सुअल है तो 20% दिस गे और लेस्बियन है, तो फीमेल लेस्बियन रही तो वो शादी कर दिया तो हस्बैंड ने क्या करना चाहिए?
देखिए साहब, पहले तो एक ये कि, sorry, I'll speak in English. What he wants to say is that if a homosexual is satisfying his relationship in a positive way, he is better off than not satisfying at all. or being a destructive heterosexual one. That should be our stand. Homosexuality and lesbians, you are born that way. ये जन्मजात चीज है. अभी का साइंस, जेनेटिक साइंस कहता है कि that is you are born that way. आज से 6th century में Varamir also mentioned the same thing, that if Venus and Saturn are aspected by each other and are in each other's nomos, she will satisfy her passion with a person of the same sex acting as the opposite sex. His commentator Rudra Bhatt further mentioned that the rule is true also for male homosexuals. अपना बोला कि ये जन्मजात है, वरामिर बोला कि you are born that way. बात वहीं की वहीं आके रुक जाती है. तो you are born that way, don't try to change it. अभी इसका आंसर ऐसा है माहेश्वरी साहब, आपको चाय पसंद है, मुझे कॉफी पसंद है, और डॉक्टर साहब को दोनों पसंद है. So you are a homosexual, I am a heterosexual, he is a bisexual. ख्याल अपना अपना, पसंद अपनी अपनी. She can be, if you are lucky. I mean, तुम जो बोलने वाले हो मैं बोल दिया. Just in a lighter way.
लीजिए.
नॉर्मल जैसा कुछ नहीं, ये है. हाँ, वाई अन्य से ख्याल अपना अपना, पसंद अपनी अपनी. हाँ सर. हाँ जी सर, बोलिए ना.
Your opinion, sir. Your opinion on.
Usually I ask my difficulties to Dr. Mutha. Today is the other way. What is the matter?
Sir, it's an honor, and please, sir, your opinion as far as the sexual problems in or your rather clinical experience as far as sexual problems in hyperthyroid and hypothyroid women.
डिजायर प्रॉब्लम कहते हैं, हो सकता है, लेकिन मैंने कोई ऐसा स्पेसिफिक केस मेरे को रिफर नहीं हुआ है कि थायराइड प्रॉब्लम की वजह से ये हुआ. हाँ, थायराइड ठीक कर लेते हैं, बट जब भी वो एक्सट्रीम केसेस पर आ जाता है, देन इट रिक्वायर्स अटेंशन. व्हेन द अदर सिम्टम्स आल्सो चेंज, at that time you require correction and it can affect an individual sexual life.
There are very
gray area, gray. जैसे कि it is something like if your PSA is 5 and the normal is 0 to 4, 5, 6, 7 में treat करना testosterone से कि नहीं करना है, it is something like that.
There are no clear cut.
No, I don't have enough experience with thyroids. Yes, sir. Yes, my friend.
Sir, I have two questions, sir. One
Sure.
is about a postmenopausal woman. So quite often a male partner comes with a history that his wife is not showing a desire towards sexual activity, maybe related to psychosocial factor related to the age. So otherwise, how do you proceed in evaluating such patients? And
Sir, I would ask 3 questions. Number 1, desire. If it is there, she said, no, मेरे को करने का दिल ही नहीं होता है. Ask about the history of masturbation, sexual thoughts, daydreaming, masturbation. Anything is that means her desire is intact. If her desire is intact, her hormone profile is intact. If her hormone profile is also intact, her also the mental equilibrium or mental sexual process is in order. If she gets wet, her estrogen is proper. If it's not wetting properly, that means either estrogen is deficient. So you give her diet which is rich in estrogen. I would say soya bean and urad and methi, all these things. If it doesn't work, local estrogen creams are available. Within a month, month and a half, she will start lubricating. You have to give a gap after a month or so, but usually that works very well. So that dyspareunia apart nikal jayega. Dyspareunia hua to you must ask whether it pains in the before, during or after. If it is before, it is phobic. If it is during, that means there is something. And if it is after, that means there is something else deeper inside. जब in the beginning hota hai, by and large it is lack of lubrication, reduced foreplay or local vaginal infection. If it is in between, it's usually because of myalgia, levator ani myalgia, which is not looked properly by most people. People even don't know about it. And deep raha, to pelvic inflammatory disease, या कुछ surgery हुआ हो तो. If you resolve that, usually if desire is intact, lubrication is intact, the orgasm will occur. Orgasm is essentially between the 2 ears, not between the 2 legs. An orgasm anyone would have. कई बार क्या होता है आदमी खत्म हो गया तो he doesn't bother. He feels that only the nipples and clitoris are the only sources of arousal. I mean, erogenous zone. There is an entire body where plenty of erogenous zones are there. You can advise sensate focus exercises, which is sensuous interplay by avoiding sexual interactions, and that can do the trick very well. Actually speaking, menopause is really menopause. आदमी को पॉज लेना है, थोड़ा मोहब्बत से आगे जाना है. You should devote more time in the foreplay. Arouse her more because it's going to take a longer time to occur, as erection takes longer time to occur. But if there is a will, there is a way out. Sorry?
Any medicines available for this?
Sir, medicines I would not advise unless there is a, if at all the local things doesn't work, then one can think about giving the oral therapy of estrogen, but only under the gynecologist's care.
Perimenopausal or postmenopausal patient, we can't prescribe estrogen gels for a long time.
No, sir, no, you don't need to prescribe for a long time. A month is more than enough because she will start generating. और एक बार शुरू हो गया, you can tell the husband के भाई थोड़ा foreplay में ज़्यादा time गुजारो. जरा husband को explain करने का कि जो मजा सफर में है वो मंजिल में नहीं है. There's always more pleasure in traveling rather than arriving. That's what I.
So quite often unmarried males who comes and complains that his penile size one is one concern, and second is he feels that premature orgasm happening. So can he correlate the real sex with the masturbation because he demands medicines to prolong his orgasm in an unmarried young male?
Sir, unmarried man में कई बार he might reach orgasm earlier during masturbation, but not during sexual experience. And if at all, सच सच बोला ना तो आगे लाइक हाँ कॉफी पिलाना पड़ेगा जवाब दिया तो कॉफी पिलाना पड़ेगा अच्छा
performing 3 times in a night, but when he came in office at 10 to 11, he gets aroused in his office.
In his office?
In his office, his business is single person in the office, and he gets automatically aroused in his office at 10 to 11 in the morning time. At that time, he masturbates himself. After that 2 hours, he again aroused. He gets again aroused. So in daytime, he aroused 3 times, and he night times he performing 3 times. So is it hypersexual patients, and which treatment we have to?
Sir, I would rule out his blood examination. कोई hemetic कोई प्रॉब्लम तो नहीं है ल्यूकेमिया जैसा. ऐसे में कई बार इस टाइप की चीजें हो सकती है. आई एम नॉट वेरी मच एक्सपीरियंस इन दैट, बट अगर आदमी को डिजायर होता है, इरेक्शन होता है, एंड ही इज एबल टू रीच ऑर्गेज्म, कई बार ऐसा हो जाता है आदमी को, मूड ज्यादा आ जाता है. Nothing wrong.
Sir, in night time partner is with him, but in daytime there is no partner.
But sir,
he is sitting in office.
मेरी बात सुनो, डे टाइम में पार्टनर नहीं है. नहीं नहीं साहब, यू डोंट गिव योर ओन एग्जांपल. सर इसमें क्या होता है, इसमें फैंटेसी होती है, एंड फैंटेसीज आर ऑलवेज मोर कलरफुल देन रियलिटीज. I mean, I can, even if I want you, I can't have you, but I can always imagine. माने हकीकत से, हकीकत की कल्पना हमेशा ज्यादा रंगीन होती है. तो कुछ लोगों को अगर हकीकत की कल्पना ज्यादा पसंद है और अगर शौक फरमा लिया, फाइन. हाँ, अगर उसके बाद उसको कुछ ब्लीडिंग हुआ, हिमेटोस्पर्मिया हुआ, बॉल्स में कुछ पेन हुआ, तो बात और है. अदरवाइज ठीक है, कभी बाय चांस ऐसा हो गया, ठीक है, कोई इसमें कुछ नुकसान नहीं है कोई. और कोई दवाई ववाई तो नहीं खाया ऐसा.
सर आपने हमारे सारे क्वेश्चंस के जवाब बहुत सही तरीके से दिया. हेलो. और हम सभी को बहुत सेटिस्फाई किया. सर रियल
बातों से सेटिस्फाई किया.
Sir, you deserve a big round of applause from all of us.
Sir, one last clinical query. Sir, do you feel there is a response, there is a difference in sexuality of a woman who has entered menopause naturally, or a woman who is menopause because of surgical hysterectomy?
Well, surgical hysterectomy would be faster. The response would be faster. The decline of desire would be faster. There are no two doubts about it. Either by surgically removed, by radiation, or by any other means. But if it's a gradual, she will go on in menopause in a gradual manner. So surgical would be much faster as compared to the natural.
So because I feel.
But both can be treated. Remember one thing.
Yes, sir.
Both can be treated
Sir,
very
but
well.
if the ovaries are intact and the only uterus is removed, so there is a hormonal support in that particular women. But in menopause, there is no ovarian support of estrogen and progesterone.
Sir, you can give diet which is rich in estrogen. We can give methi, which is a known thing to increase. At the same time, soybean, they are known to increase estrogen. अभी 100 साल के पहले कहाँ डॉक्टर मुंह उठाते?
Sir, doctor.
हाँ, वहाँ कहाँ दवाइयाँ थी, समझे कि नहीं? हाँ.
See, when the ovaries are removed, when there is a time hysterectomy or hysterectomy along with oophorectomy, then only the surgical menopause will take place. If only hysterectomy has taken place, keeping the ovaries intact, then there is no surgical menopause.
Tell also at the same person, not a, oh bhai, tell the same person, not the neighbor. नहीं तो एक का यूट्रस की बात करते हो, दूसरे का ओवरी की बात करते हो, ऐसा.
Hi friends, thank you sir for a beautiful lecture, sir. Because we think if I ask the question, what is sex? So we all think to enter the penis-in vagina, penovaginal sex. So as age grows, we have to think another way of the sex, non-penovaginal sex, and we go for that. Many of the aspect of the clitoral stimulations, kissings, and many of the things are there. So, sir, I just got the newspaper cutting edge at just 12 weeks when I was a student. So I just collect that paper. Sex has no expiry date. So it's really proof for that. If a 70 years of the male is just touching and such type of giving the clitoral stimulation of his wife, so you are also safe for that is also having sex. If he is unable to have such penovaginal sex, so it's really it's a very vast for that, and we think another as age grows for that. Thank you, sir. Thank you.
One question.
Last question, and then we are
Sir, management in experience of fatigue for 24 hours after sexual intercourse in young patient.
Sorry.
Feelingness of fatigue for
Yes,
24
yes.
hours after sexual intercourse.
Yes, you are right. Why fatigued? Fatigue is not because of the value of going out of semen, but when you reach orgasm, mutha baith jao. When you reach orgasm, there is contraction of the big muscles, gluteus, almost all muscles come into spasm. So these muscles go into spasm. That's why you feel tired. That's why you feel fatigued. Well, I have not done any double-blind studies, but I advise my clients what Charak has advised. Charak says, okay, you must advise Rasayan. Rasayan means which retains the youth and delays the process of growing old. A glass of milk with a teaspoonful of cow's ghee and misri. Why cow's ghee? Cow's ghee sharpens the memory, reduces the acidity, avoids constipation, gives strength. And cow's ghee, not buffalo's ghee, because he says the strength which the ox has got, the male buffalo does not have. 50 गाय के बीच में एक ही मेल काऊ रहता है, 50 भैंस के बीच में 55 भैंसा रहेगा तो भी satisfy नहीं करेगा. And misri. Now this is what he advocated, and there is nothing wrong in prescribing it because he says that this is rasayan. Rasayan means which retains the youth and delays the process of growing old. It doesn't increase cholesterol also. So I would say that suppose if a man is tired, exhausted, and if you advise this, he will benefit. At the same time, he will feel happy and it will not do any harm whatsoever.
Thank you. The problem here occurs for such men who feel post-coital exhaustion is that many of them wants to, pack up and wants to go back to home. So problem occurs for them, not for others. Others sleep peacefully after the act. A couple of important announcements. Sir has generously distributed this small booklet having, various diagrams and pictures which can be used to assist the counseling process. Unfortunately, they were little less. So those who have not received, we will be creating a PDF and we will be emailing to you. We have email of all of yours through registration. So we will be emailing it to you. So don't worry, you will receive it, take printout and use it as an educational tool in your clinic. Okay?
I request everyone to.
Second thing about the certificate, you will receive it tomorrow, both our conclave as well as workshop certificate. And since in the afternoon time when you registered, our delegates' kits were not ready. They did not arrive. So we were not able to give you. Now we have it. So while going back in the lobby at the registration counter, you please again register yourself, sign and collect your delegate kit. Without fail, you collect it today. Okay. And coming back to our session, a 4-hour session with break, but in fact it wasn't a break for him. People were continuously interacting with him. at a very tender and young age of 79,
I would request everyone to give a standing ovation.
he deserves all our respect, our love, our affection for his efforts, his contribution for more than 5 decades in sexual medicine in India. Today, if 150 of us which who are here and maybe 1,050 who are not attending this conference have choose to take sexual medicine just because the path was made by this gentleman.
Once more, bigger, louder.
Imagine 50 years ago, if someone is uttering a word of sex and is introducing himself as a sexologist. 20 years ago, I was looked upon as I am from some extra territory. Sexologist हो आप और लोगों का देखने का नजरिया बदलता है. तो imagine 50 years ago how much guts a person needs to call himself a sexologist. The branch which was with Khandani Shafakana and all those people, newspaper में advertise देने वाले, common public urinal में निराश ना हो, शादी के पहले शादी के बाद आकर के मिले, ऐसे लोगों के बीच में एक अपनी साइंटिफिक सेक्सुअलिटी को क्रिएट करना, उसको एक रिस्पेक्टेबल स्टेज पे लेके जाना, ये कोई खाने का काम नहीं है, कोई छोटा काम नहीं है. इसके लिए ये मेहनत है, ये बाहुबली कार्य है. एंड सर, वी रियली अप्रिशिएट. Yes. He has written a book, Common Sexual Problems and
Actually,
Understanding Orgasm, which was his original thesis work, for which he is awarded PhD, which I did not mention in his introduction, because his introduction is so vast. If I read out everything, still I will miss out something. So once again, a standing ovation and a feeling of gratitude towards Padma Shri Dr. Prakash Kothari sir. So his services were recognized by a government of India, and President of India had conferred him Padma Shri Award much before many other. Thank you very much, sir. So some people can go on the stage. We youngster
Oh, nice. Oh, sorry.
Pleasure. My pleasure.
So you're 79. It's remarkable. हाँ जी. अभी जब हम लोग short है ना. हाँ, साइड पे आ जाओ.
ऐसा मत करो.
अच्छा.
Welcome.
हाँ जी.
Someone has picked up my booklet.
Yeah.
From where I will create PDF.
I'll give you.
Very happy, Didi.
अरे ऐसा मत करो. आराम से.
साइड पे आ जाओ.
नहीं.
ए बाजूला साइड
ये बहुत कंजेस्टेड कर दिया. किधर जाए?
अरे हाँ.
कटकर साहब जरा क्या?
कैसे कहते हैं? थोड़ा साइड.
पीछे
अरे ऐसा मत करो. धक्का मत करो.
थोड़ा सा बदले.
बस अभी यार इतना.
सर ले लो यार.
सबको ले लेना.
हाँ. कट पेस्ट कर रहे हैं ना जो
सबको
नहीं.
ले लो.
पप्पू भाई कुर्सी पे चढ़ना है तो कुर्सी पे चढ़ना है.
मैं
प्लीज कम.
मैं ऊपर जाऊं.
दौड़ो.
हाँ ना.
हाँ ले लो.
जिन्होंने मास्क लगाया मास्क हटा दो.
Thank you.
So you're there for next 2 days also?
Yes, sir. Good tomorrow morning.
Tomorrow morning.
Yeah. Nice meeting you, sir.
So my pleasure. I'll be in touch with you.
My
You had
pleasure.
mentioned, how do you mention you are there's a BP cup and all? I've never heard about this.
वो पुराना है, बहुत पुराना है सर, कोई बड़ी बात नहीं है उसमें।
Neonates वाला होएगा।
नियोनेट्स वाला बिल्कुल वही उसी टाइप का है। हाँ जी, रॉ 1 teaspoonful to be swallowed with a glass of water. Seeds.
वो जो अपना भिगो के ना,
रेडिश ब्राउन होते हैं।
यानी मेथी को उसको स्प्राउट करके या
नहीं, डायरेक्ट स्प्राउट नहीं करने का, बिकॉज वो उड़द दाल मैंने बताया लहसुन का और हिंग का तड़का लेके 1 teaspoonful, about 10 grams, 5 to 10 grams.
So how you take it? Is so hot?
No, you have to swallow it, gulp it down. It will take
their time which is allotted to them
should
be
as well as
available with them.
दोनों आपके
And there will be, according to the program, if you see, this will be our main hall A, that is Dr. Vatsa hall, and we will be having another hall B, that is Dr. Saroj Gumaste hall. So inauguration program and all 3 plenary programs will be here. Rest will be divided depending on your preference. You can shuttle from one hall to the other hall and burn some calories so that you feel hungry. And at the end of the day, you will have very nice food.
कॉफी पिलाने का है आपको? कॉफी
Those who are interested to do yoga on beach by seaside should contact Dr. Sudhakar Petkar from Maharashtra at 6:30. All can gather near swimming pool, and from there one can go to the beach and will do the yoga. Okay. Hall A is this and hall B is the other one. The scientific programs will be shared with you. We have already shared on your WhatsApp and on your email. But tomorrow we will be giving the pamphlet also. So depending on your preference, you can select the hall. Okay. Those who are desiring to click photograph with Dr. Prakash Kothari while receiving the certificate, we have got some
very nice
blank models to take photographs.
My pleasure.
एक मिनट जरा ओनली दोघांचा
सर
कोण केलं दोघांचाच घ्या अभी गुरु का
सर बैकग्राउंड में जाइए.
अरे इच्छा नहीं है वैसे तो क्या अरे सर अभी अरे नहीं यार अरे इधर अरे क्या लगा मैं यार अरे थक गया यार बहुत थक गया. थैंक यू बॉस. तुम्हारे दिल में हूँ साला, इधर क्या है जरूर वेरी गुड वेरी नाइस. आइए साइड में
एक मिनट दो सर दो हम लोग हाँ
यस
थैंक यू थैंक यू.
हाँ अभी सर अब
थैंक यू थैंक्स थैंक यू सर. हाँ जरूर जरूर. थैंक यू डॉक्टर. इकडे दिस वुड बी बेटर. इकडे नाही सर
फॅन्सी हॉटेल.
मैडम जा.
ठीक है. थैंक यू सर.
Be in the center. Sorry, come like this.
थैंक यू थैंक यू. माय प्लेजर.
तुमचा पण काढू सर.
आम्ही तुम्हाला जे आवडतोय माझं मेन पर्सन बस. ठीक है बस तुम ले ना यार. થેન્ક યુ.
એક ચીજ મુઠાએ ઉતાવળ કરી નાખી.
હા.
મારે લોકોને કેવું હતું કે તમે પદ્માસન પર આ ઉંમરમાં બેસી શકો.
અરે થેન્ક યુ વેરી મચ સર. વેરી કાઇન્ડ ऑफ यू. थँक यू.
डॉक्टर दिनेश महाजन नाशिकला कधी आले?
हा मी आला येणार नाशिकला पक्का.
स्टेशनच्या जवळ.
चला.